reading part C, rabbit calcivirus disease, calicivirus disease, right? Sorry. Our CD, this was sent by someone, I don't know, we have sent it. We'll be dealing with that, saying that it's very challenging. I don't know the authenticity, and we EduSkills, we respect the copyrights. I'm not sure from where this text or this one originated. Yeah. And strategy is usually hedging words, name, look for answer after contrast word. Fourth one, ignore the subject complements, understand the topic sentence, synonyms, synonymous language, paraphrasing, and sorry, the last one I can't see. Who can read for me?
Elimination.
Elimination. Okay, elimination. Sorry. That is, my screen is a bit disturbing. One second. Yeah, these are the basic things you have to master. As we go on, we will think of it. Okay. Yes. Now the thing is, I am still confused about concept base and differentiate keywords from question. This is a concern, question and answer. Posted. Actually, this is concept based and differentiating keywords. Rest of them we will read later. There are many concerns. Where can I find authentic materials? We'll come back to it, okay, at the end. Now, the basic thing asked when the first question is OET question analysis. And mind you, your success depends 90% in your ability to do the question analysis, not in the reading text. If you're able to master the question analysis method, then definitely you can manage time. At the same time, it becomes very easy and you will definitely crack or nail OET. So this is the most important aspect. 80 to 90% of your success depends on how much time you spend on the question analysis, not the text. Okay, OET question analysis, understand question for the beginners, because unless I tell them in the beginning this one, they will not understand what I am going to speak in the questions again. Question has two parts. OET question has two parts. One is question stem. Second one is answer options, maybe 3 options or 4 options. And underline the hedging words, keywords. I used to highlight. Now, if you don't understand the highlight, I change it to underline the hedging words. Okay. If I'm going fast, you can just stop me and tell me I'm going too fast. Okay. I'll try to be slow. I don't know how far my throat will help me. Hedging words. When you speak of hedging words, there are 2 types. Anyone? What are those?
Concept-based and differentiating hedging words.
No, 2 types in the question stem. There are 2 types in the sense, hedging words in the question stem and hedging words in the answer options. They are entirely different. Okay. There are 2 types. One is in the question stem. Other one is in the answer options. For example, in the question stem, there will be a modal verb. If there is a modal verb in the answer options or in the text, that is not the criteria. Unless the question modal verb is in the question stem, that will not help you much in locating the answer. So we'll come back to it. So which of the following is not mentioned in the text? Okay, this is question stem. This first line, which of the following is not mentioned in the text, is the question stem. If there are some beginners, since someone was messaging me, I'm a beginner, I don't know what it is. So this is the reading part C. There will be 2 texts. And in those, we will have 8 plus 8, 16 questions. Okay, question stem, the first line. Then A, B, C are the 3 options, answer options. Okay. Yes. OET question analysis, underline the hedging words. Hedging words in the question stem. Name, cause effect. Maybe they'll be asking for a reason, because, due to such things. Singular and plural. Modal verb, tense. These are the commonly appearing hedging words in the question stem, not in the answer options, in the question stem. Okay. Now underline the hedging words, keywords. Hedging words means keywords. Okay. Keywords, main words in the question stem and answer options. Hedging words in the answer options, as somebody, Jyoti really mentioned it now. One is concept based, second one is differentiating, third one is emotion-based. Okay, these are the three. Concept-based means subject-based. Each answer option will deal with a subject. It can be about one subject or different subjects. So you should know what is the subject. We will take an example and explain to you. Second one is differentiating. Which are the words that differentiate option A from B, B from C, C from D, or those things. Third one is emotion-based. Especially in reading part C, you have attitude-based questions, asking for the attitude or opinion of the author or writer. So emotion, their emotions, emotion-based words will be mentioned in the answer options. It doesn't mean you will have all these three types in all the questions. Sometimes you will have only one word each in option A, option B, option C, option D. But then some will have one, some will have two, some will have all the three hedging words. Okay, now let's check one example. Yeah. Now you can interact. Those who have no distractions at Zoom classroom can interact. Okay. One sec. Yeah. Hope you can read it. Try to Zoom if you are watching on a phone. Okay. Try to Zoom. Because if I have to highlight, I have to do this here. Okay. The question stem is this line. In the first paragraph, it is suggested that Dr. Longo feels. What are the hedging words?
Dr. Longo.
Dr.
Longo
feels.
feels.
Dr. Longo.
Longo is very
Feels.
important. Name, then feels.
Feels.
What does it say? Feels.
Feels.
Emotion.
Emotion.
Opinion.
Okay. Suggested. That is opinion. Okay. And first paragraph for beginners, you have this tells you have to number the paragraphs. As soon as you get the material, number the paragraph 1, 2, 3, 6 or 7 paragraphs, number them so that immediately you can go to in the first paragraph, sixth paragraph, fourth paragraph, last paragraph. Okay. Now tell me here, first we need subject-based, concept-based hedging words, concept-based keywords. What are the concepts? Option A, annoyed that certain Alzheimer's treatments are not approved for human use. What is the subject here? Main subject.
Treatments.
No. Subject. The treatment is differentiating.
Alzheimer's.
Yeah, Alzheimer's is this. Alzheimer's is the topic. All the 4 options have the same subject. Sometimes it may be different. Okay. So you have Alzheimer's here, Alzheimer's here. So all the 4 options are speaking about Alzheimer's. So you cannot make any differentiation in the subject. Subject is same. Sometimes there will be different subjects. Now coming to differentiating hedging words. Somebody said here, treatment.
Can't see the screen.
Pardon?
Now okay.
Okay, again, there is some issue, right?
For a second, it was black for this. Now okay.
Okay, I'll have to go back and come. If it continues, let me know, okay, because I'll have to close the sharing and come back again. Treatment is the differentiating hedging word. Option B, concerned that the Alzheimer's drug LM11A31 may prove ineffective. Differentiating?
Ineffective.
No.
LM11A31 ineffective.
Yeah, like differentiating could be simply drug.
Again
means?
blank.
Again blank.
Okay, then let me just stop sharing and come back. Some technical issue. You aren't smiling, I believe that's why these issues occur. Where am I? Share. Yes, let me try sharing again. Send some emojis. Yes. Let me know if the problem is solved. Okay. Yes. Now, third option C. Surprised that so little is still known about what causes
Again,
Alzheimer's.
Father.
Again blank. No back.
Mhm. What's happening?
No, okay.
It's okay
Okay.
now. Yeah, I can see now.
Let me check. So option C. Surprised that so little is still known about what causes Alzheimer's.
About
Process.
process.
Causes. Yeah. Cause. First one was treatment. Second one, drug means treatment. Third one is cause. Fourth one, frustrated by the lack of progress towards treating Alzheimer's. Treating. Yes. So you see, differentiating hedging words are same for option A, B, and D, whereas it is different for C, option C.
Same issue, Father.
Yeah, again,
The
blank.
screen is gone. Screen is gone.
No, back.
Let me check. Let me check. Give me 1 minute. When yeah, let's try again. Yeah. Please don't scribble on the screen. If there are newcomers, please don't scribble on the screen. We are not familiar with the screens. Don't touch it, okay? Yes. Is it okay now?
Yes, Father. Yes.
Yes, Father.
Yeah. So,
Yes.
so all these three things are over. To subject or concept-based hedging words, same. And differentiating hedging words, first option A speaks about treatment, B drugs treatments, 3 cause, 4 option C, D again treatment. Now, what are the emotion-based hedging words?
Annoyed.
Annoyed,
Concerned, surplus,
Concerned,
frustrated.
surprised,
frustrated.
Frustrated.
surprised, frustrated.
Does it go blank now?
No.
No, Father.
Yeah,
No.
because you all smiled. Why didn't you do it earlier? Yes, concern, then option C.
Surprised,
Surprise.
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 Yes.
Frustrated.
Frustrated.
I
Frustrated.
see. These are the 4 emotion-based question words. Suggested Longo feels what? Does he feel annoyed? Does he Longo feel concerned? Does he feel surprised? Does he feel frustrated? His feeling, you have to understand from the text what is his feeling. Okay? Is he annoyed? And I meant, annoyed, concerned about something, surprised about something, frustrated. Yeah. Someone, if you could just assist me in reading. Smile and read, someone. Yeah. If you don't smile, the screen will go blank.
As chairman of the Department of Neurology and Neurological Sciences at Stanford University School of Medicine, Dr. Frank Longo knows how destructive Alzheimer's can be. The disease was discovered in 1906, but despite more than a century of research, including the testing of over 200 new drugs in the past 2 decades, there are still no real treatments. As Longo says, we've cured Alzheimer's in mice many times. Why can't we move that success to people? He's referring to numerous promising compounds that have eliminated the amyloid plaques associated with Alzheimer's in animals. However, if ongoing trials continue to go the way he hopes, his new drug called LM11A31 could be a critical part of finally making that happen.
Yes, thank you. And now, what do you think is the feeling of the person? Now, Dr. Longo, there is a name, but then the whole paragraph is speaking about only one person, and his attitude is in the question. So you did not search for the name. The whole paragraph, everything is spoken by Longo. Yes.
Is frustrated.
Yeah, frustrated. Why is frustrated?
The lack of
How
Now you see, as chairman
There
of
is
university,
no
all
real
these are, what are these? First part of this 1.5 lines?
compliments.
Yeah, there are subject complements. You can just ignore those details to save time. Okay,
Yes.
Dr. Frank Longo knows. Yeah, how destructive Alzheimer's can be. How destructive. How terrible this OET exam is. Yeah.
Yes.
What is are you annoyed or concerned when you say how horrible it is? Are you annoyed? Are you concerned? Are you surprised? Are you frustrated?
Frustrated.
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 Yeah. If you understand that, that's enough for getting the answer. Rest you need not understand the text at all. If it doesn't mean OET, you have to understand everything. If you know the strategies, just need not understand what is the content. Okay? Let's see content. Frustrated by the lack of progress towards treating Alzheimer's. Lack of progress. You can think of lack of progress. There are still not real treatments. Lack of progress, right? Regarding treating. Yeah, lack of progress. Why can't we move that success to people? We succeed in animals, not succeed in human beings. Again, frustrated, which means there is no progress in treatment, lack of progress. The whole paragraph, the taste, color, smell, fragrance, and everything of the text is frustration.
Yes.
That's why I said, unless you understand the questions, it's very, very hard to locate the answers in the text. If you understand the strategies, you don't require to understand everything in the passage. And good deal of time, more than 50% of the time, you need not read even half of the passage. Maybe 1 or 2 sentences will be cool. Once you are competent, Dr. Frank Longo knows how destructive Alzheimer's can be. That itself says it is frustration. It is frustration. How destructive COVID-19 can be. Frustrated by COVID-19. Okay? Is that cool?
Yes, Father.
Yeah. Let's go to the next. Check. Where are we? Yes. So, reading for emotions. See now, option A, OET is difficult. Okay. Option B, despite of hard work, there is no real progress in their scores. We feel helpless that we are not able to make all OET aspirants successful. Frustration. We'll give you a text for it, okay? Then you'll understand. Okay, this is a created text, OET text created for EduSkills, okay? Now, in the following paragraph, it is suggested that Miss Anand feels. What are the hedging words?
Miss Anna
Anand.
P.
Miss Anand refers to one of our former admins, okay? Present admin, but senior most admins, yes. Arya Anand, yeah. Anything else?
Feels.
Feels.
Feels, okay.
Suggested.
Feels. Then
His opinion. Suggested.
suggested opinion is
Suggested.
okay. Okay. In the
Yes.
following paragraph, yes. Now, annoyed that a few OET aspirants are not interested in scoring good grades. What is the subject?
OET.
OET aspirants.
Yeah. Someone has a distraction at the background. Child is there. Please don't interact, okay? If you have a distraction. OET aspirants. Check. Admins, please check. Please, if you are not able to attend, please don't come to Zoom classroom, okay? You can watch it. YouTube Live. Okay, cool, smile. Option B, concerned that the guidelines by EduSkills may prove ineffective. What is the subject?
EduSkills.
EduSkills.
EduSkills. EduSkills.
Surprised that option C, surprised that so little is done by EduSkills to improve the scores of the OET aspirants. What is the subject?
EduSkills.
EduSkills.
EduSkills, okay. Option D, frustrated by the lack of consistent guided practice by the OET aspirants.
OET aspirants. Subjects.
OET
OET aspirants, yeah. Okay.
Yes.
Now, what is the differentiating edging words?
Good.
Not
Interesting.
Not
Good.
interested.
not interested.
Okay.
Improve.
Ineffective.
Proof
Prove
ineffective.
Not interested.
Ineffective.
These are not sure that you can highlight anything for your understanding. Okay, they not be exactly this, but we are showing a model how to do it. Yes. Second one.
Green and blank.
Black.
Effective.
Not clear.
Ineffective.
Second one, concerned that the guidelines of education may prove
Proof
ineffective.
ineffective.
Okay.
Proof.
Yes. See, surprised that so little is done by EduSkills to improve the scores of the aspirants.
This
Lack of improve the score.
scores, including scores.
Okay, scores of the OET aspirants.
Okay.
Frustrated by the lack of consistent guided practice by the OET aspirants.
Lack of consistency.
Lack of consistency.
Okay. Okay, now why Anand, the Arya Anand, the admin is frustrated? They are asking for a reason. Is it because the OET aspirants are not at all interested? Is it because EduSkills is ineffective? Or is it that EduSkills has done nothing to improve the scores? Or is it because the OET aspirants lack consistent guided practice? So these are the things. Now, what are the emotion-based hedging words?
Annoyed.
Annoyed,
Concern,
Concerned.
Annoyed,
and frustrated.
concerned, surprised,
Okay.
frustrated.
Surprised.
Yes.
Frustrated.
Yes.
Yeah.
Yeah. Now somebody who can smile very powerfully and read out simultaneously can read. Smile and read. These are good opportunity for you to build up the confidence. Okay. Confidence is as important as competence. Don't worry about mistakes. Your mistakes are syllabus. We are all learners. By making mistakes, we learn. Yeah.
As an admin of Edu Skills International, Ms. Arya Anand knows how difficult the OET can be. Many OET aspirants started their training in 2025, but despite more than 15 months of hard work, including trainings from various institutes, there are still no real progress in their scores. As Arya says, we have commendable success rates in the past years. Why can't we move that success to all OET aspirants? She is referring to numerous successful OET aspirants who are already settled in various European countries. However, if the OET aspirants follow the guidelines by EduSkills, especially those who are enrolled in the new OET batch 2023, could make their way to their dream country happen.
Okay. That's a mistake. Yes, this should be 2026. Yes. Right. So, what do you think? The emotion of Arya Anand? How difficult?
We have commendable
Last
success
word.
rates in the past years. Why can't we move this?
Okay. What
Frustrate.
is
Yes.
how difficult OET can be?
How difficult.
Is it annoyed or concerned or surprised or frustrated?
frustrated,
Frustration.
Frustrated.
Yeah, there are no.
Real
No,
progress.
There are no progress. In spite of such long trainings, there are still no real progress in their scores. What is the feeling?
Frustrated.
Why can't we move
Frustrated.
at success rates to OET aspirants? What's the feeling?
Frustration.
Yeah, ultimately frustration.
Frustrated.
Yeah. Arya Anand, admin Arya Anand is frustrated. Okay.
Yes.
So just understand that. And even otherwise, from the very first sentence, how difficult it could be, from there you can understand what is the feeling. How difficult, how horrible, yeah? Yes. So, as I said, reading for emotions, then frustration. See, OET is difficult, frustration. Despite of hard work, there is no real progress in their scores, frustration. We feel helpless that we are not able to make all OET aspirants successful, frustration. If OET aspirants follow the EduSkills guidelines, all can crack OET, frustration. As of now, OET aspirants are not following EduSkills guidelines. If OET aspirants follow, means now they are not following. If you follow, so that is frustration. Cool?
That is
Father,
frustration.
Yes,
Father.
please. Yeah.
But the statement one said OET is difficult is a factual statement, Father.
Yeah. It's a factual statement, definitely. Yeah. You mean you experience it, right?
Yes, yes, Father. I'm
But
experiencing.
but if you make such statements, I'll have to send you to the jail. Because OET is so interesting, so simple. If you have little patience, the thing is this, you have to take the proper treatment. Now you
Yes,
say
Father.
you have you have some
Father,
sickness.
when
Sorry.
you teach, it is interesting, Father.
No, even otherwise, it's not
When
because of my
you
teaching. The
teach, it
material.
is very interesting, enjoying.
No, it's not my teaching. The material is interesting. That's why I'm able to teach you interestingly. If the material is dull or difficult or challenging, how can I teach it interestingly? Only thing, the treatment taken is not proper. And you say the condition is not improving, or the sickness, you are not getting out of the sickness. Okay? So the treatment should be proper. The medication should be proper. You have some trouble in your intestine and you conduct a surgery for the heart. Will it be okay? No. So that's what you are doing. You aren't treating the condition with the proper strategies or tips or things. So definitely we'll see. It is interesting. Okay. So all these same things. Cool explaining. Yeah. So annoyed approving treatment, not approved for human use. Annoyed that certain RCMS treatments are not approved for human race. Approving treatment not given. So it is frustration. Drug may prove ineffective. Again, frustration. Cause of Alzheimer's is not given. And lack of progress towards treatment correct. Okay, there is no progress. All these are same in the text. Let's go back to the next concern. Okay, this is the next concern. All these are given by some aspirants, okay, sent by some aspirants. Which of the following is not mentioned in the text? Concern is this, okay? You'll have to answer me. Concern is concern one, the doubt one. Option A and B both are not mentioned in the text. Then how option C is correct? Somebody has taken a screenshot from my video and sent, Father, you are teaching nonsense. Okay? You are saying options that, please, this Prabharani. If you don't mute, you will not be there, okay? Yes. Yeah, sorry. Because since long, she is not attending. Yeah. Doubt one is, this is a screenshot taken from my videos and they have sent with these doubts. One voice is sent. Okay. My first doubt is that option, the person says, whoever it is, a person, that's not our matter. Option, maybe more than 10 people have sent concerns regarding this particular video, and this question I explained in one video in the YouTube comment space as well. So I'm explaining it in detail. One doubt is that, or challenge is that option A and B both not mentioned in the text. Then how option C is correct? Okay. Now the question is, which of the following is not mentioned in the text? What are the hedging words?
Not mentioned.
Not mentioned.
Yeah, not mentioned is the hedging word. Okay. Not mentioned is the hedging word.
Hedging
Now let's see. Second concern is this. Second challenge. Option A and B, A and C are opposites. Therefore, one of them will be the answer. Option A and C are opposites. Let's see. Concern 3, doubt 3. Option B includes two absolutes. Therefore, option B can be eliminated. Concern 4. Are these tips applicable to all the questions? Okay. Now let's see the options. Option A, some syringes can contain a mixture of two different medications. Are the hedging words?
Can contain.
Can contain mixture.
Two
Contain.
different medications.
Can.
Contain
Two
Different
different medications.
Two different medications.
Okay. Now option B, needles must never be broken after administering medications.
Never.
Okay.
Never
Must.
broke.
Must.
Must.
Never
Never.
eliminated.
Never eliminate or should eliminate?
Should
It's a never, I cannot. It's again you are using an absolute there. Okay. Needles must never be broken after administering medications.
Yes.
So you have to eliminate it, right?
Yeah.
Yes.
Never be broken.
Okay. Now, that means one of these two must be the answers. Two syringes of the same type cannot have different medications.
Two syringes of the same type.
Cannot
Have different medication.
have. First one says can contain.
Can contain.
Oh, I'm not able to highlight. This one is disturbing me. Cannot have. Okay.
Yeah.
Different medications. So what are they? Can contain and cannot have.
Opposite.
They are opposites.
Opposite.
Opposite means one of them must be the answer. So how many strategies are being used here? We'll check. Okay. We'll check here. Can contain. Let me check. Okay, let's check here. Tip 1. If there is an absolute expression, delete the option. We have done it, right?
Yeah.
This has got two absolutes, so we have eliminated it. Okay, so you have two options now. Tip 2. Tip 2. If there are two opposites in the answer options, one of them is the correct answer. The other two, there are the other two, the other options. One sec. The other options or option is eliminated immediately. If there are two opposites, we have can contain,
Cannot contain.
contain, cannot contain, cannot have. Cannot have means cannot contain. Synonymous language. Okay, so one of them must be the answer. Even if you don't have a absolute here, that can be eliminated with the second tip, right?
Yes.
Even if you have no must and never is not there, even then you can eliminate because these two are opposites. When there are two opposites, maybe in the reading part C, there will be 4 options and 2 will be opposites. So other 2 will be eliminated. So 50% eliminated. Your work is done 50% easy. Okay. That is called in Malayalam, Kuttatan principle. Okay. Yes. So these two are opposites. Now let me check. My screen works properly. Okay. Okay, now aseptic techniques. Concern one option A, B, and B both not mentioned in the text, then how option C is correct. One challenge is this: option A and B both are not mentioned in the text. Then how option C is correct? As we said, either C or A must be correct, right?
Yes.
Yes.
Now the person is saying A and both are not given, not mentioned is asked. So both are not mentioned in the text. Somebody please read.
Father cannot see anything. Cannot see the screen.
Others respond.
Why is visible?
We can't see.
Yes,
we can't see. Yeah.
see.
Maybe
It is
the one who
visible.
cannot see,
Visible.
maybe you can refresh your page, ma. Maybe your internet issue.
Excuse me, Father.
Please.
Hello.
Yeah, please.
Father. Yeah, you have called my name that time. Actually, I couldn't see anything. I couldn't hear anything from you, Father. Anything you have mentioned?
No, maybe I called, maybe I thought your audio was on, ma. You could not hear, but your audio was on and all your family people conversations we were able to hear.
Sorry for distraction.
So again, we respect your privacy, because if some your home people at home want to scold you, privacy will be violated. So we wanted you to be click muted when you are not speaking. Okay.
Oh, okay, Father.
All right. Okay. Now, who will read with a smile?
Father, I will read.
Yeah, please.
Okay. Aseptic technique. Aseptic technique must be used when handling syringes and needles. The needle, the tip and the hub the inside of the barrel, and the plunger must be kept sterile at all times. Contaminations of the plunger will contaminate the solution or medication as the plunger goes down the barrel. All syringes should be labeled with the name of the medication. If two or more syringes of the same type but containing different solution or medications are being used, they must be clearly labeled to prevent confusion. If a needle is broken, it must be accounted for in its entirety. Bending, sharing, breaking, or recapping contaminated needles is strictly prohibited. Thank you, Father.
Okay. Now, some syringes can contain a mixture of two different medications. The challenge is that option A is not mentioned, not given in the text. Is it given or not given?
Yes, it's given.
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 Given, Father.
A
Given.
is
Syringes
given
can contain a
here.
mixture
Option
of
A is given here. Two or more syringes, synonymous is some syringes are being used, can contain, okay,
It contain
a mixture
different
of two
solutions.
different medications containing different medications, solutions or medications. So that is paraphrasing of the A option.
Father is
Two or
black.
more. Screen is
Yeah.
black.
Now
No.
back. Okay.
Now it's
No.
came.
Back.
Now
Like,
it's working.
Okay. You have to tell me if it repeats, okay? Then we will not go to full screen at all. Okay. See, same, some syringes, two or more syringes, then can contain are being used, and mixture of two different medications containing different solutions or medications. These are the synonymous expressions. So A is mentioned in the paragraph. And if you know, you have only two things now, right? A or C, you have to decide. If A is mentioned, then you need not see anything else. C must be the answer.
C
will never be mentioned. Two syringes of the same type cannot have different medication. That is the opposite
medication.
of A. If it is not mentioned, if it is mentioned, you can have a mixture of two different medication. If that is mentioned, you cannot have is not mentioned. Opposite, right? So that must be the answer. The only thing don't get, I find many of you have responded, even in the YouTube, some strangers have messaged that this is not correct, Father. Okay? I understand you are not able to understand this type of questions, but then don't worry, these are very rarely you have. And if you are satisfied with the 450 marks, you need not break your head on this. Because you are all positive people, you cannot think of negative. What is not mentioned, you are bothered only about mentioned things. When you think, when you read, you are searching for the answer. Answer will not be there. This answer, one of these answers is not mentioned, but you tend to search for the answer. You won't find. Okay? So this could be the last option for you to answer. You can just tick and go if there is a question. Okay, only when you need 500 marks, you can struggle with it. Majority have a challenge with this, I believe. So what is the answer?
Two syringes at the same time. C.
Yeah. C is the answer. Okay, I did not highlight. You understood, right?
Green went blank.
Yeah.
Clear now?
Yeah.
Yes, clear.
Yes. Now, C is the answer. Okay, concern 3. Option B includes two absolutes. Therefore, option B can be eliminated. That we have seen. Now, concern for all, are these tips applicable to all the questions? What do you say?
Yes.
Yes.
Tips are applicable. There may not be these tips. There are a couple of tips, 8 tips at least, major tips. Out of those 8, if you know 6 tips, definitely you can crack any example. But then still, I'll show you some of them. Okay, we'll go glance through. Then we are going to the listening part, see the full text. Calcivirus, something like that. I don't know. RCD, the condition, we'll be looking at it. Grab some snacks and all that. I'll give you 2 minutes. before we start the full text. Now, just to show you how these the tricks or tips or strategies, actually they are strategies, okay? Your colloquial word term is tips. I never use that word tips, but then all my admins said, unless you tips, they will not understand tips. They search for tips, they will not get your video, okay? Okay, so I started saying tips and tricks. There is not tips and tricks, but strategies, okay? And we'll take only the most of the things from the official website things to check, verify that's the best option for the website material. Understand the question? Top tips, hedging words or keywords in the question, stem and answer options we have seen, okay? Now elimination, fact and opinion, look for modal verbs. Elimination, look for absolutes. Elimination, look for opposites. Elimination, look for singular and plural. Elimination, look for general and particular. Elimination, look for tense. Elimination, look for, what's that? I can't. Last one, please.
Sequence.
Sequence, okay. Look for sequence. These are the eliminations. There are 7 other principles I have taught you, but I'm giving you simpler tricks, okay? To show you these eliminations are being used, these tips are used in all the materials. Just see what is identified as the most common cause of patient complaints. I'll just reduce. Let me see.
Source of patient complaints.
Yeah.
Hedging words.
Hedging words.
Most
Common cause.
Common cause.
The common cause. Okay. Right. Option A, serious clinical errors.
Clinical errors.
Clinical errors.
Clinical errors. Option B, communication problems and unmet expectations.
Communication problem and unmet.
Yeah, both will have to highlight. Yeah, only failures in medical treatment.
Medical failure.
Only absolute.
Only and always.
Absolute.
Only is?
Absolute.
So?
Eliminate.
Option D, always staff negligence.
Staff negligence.
Absolute.
Eliminate.
Eliminate.
Yeah.
The answer is B because there is a and.
Yeah, that for the competent people, normally among the 7 principles I taught you, if you have not seen, you can go and watch elimination method. There I said when you have a conjunction in an answer, most probably that is the answer. Exceptions could be there. Okay, most probably. Second principle, the longest answer has the most chance to be the right answer. Longest answer option. Longest answer option. Here both are applicable here. So we highlight this one. Somebody commented this is the right answer, but don't believe them. Okay. Don't believe me as well. I did not say that. Somebody commented. So I highlighted that green, communication problems and unmet expectations. But let's see if there is objection. Somebody will smile and read. Sorry, there's no screen problems. Yes.
Managing patient.
Yeah, one of you.
Yes, continue. Yes, continue.
Managing patient complaints in healthcare. Patient complaints are an important source of feedback for healthcare organizations and can contribute to service improvement.
Please stop. There is one instrument disturbing. We'll have to do a solution admins.
Fatima Yusuf.
Fatima, you don't mute.
Sir.
Please mute your audio. Especially when someone is reading others, please mute. Only when you interact, please on your video. Could you read from the beginning again, please?
Yes, Father. Yes, Father. Managing patient complaints in healthcare. Patient complaints are an important source of feedback for healthcare organizations and can contribute to service improvement when handled appropriately. Most complaints arise from communication breakdowns, unmet expectation, or delays in care rather than clinical incompetence. Effective complaint management requires timely acknowledgement, clear explanation, and where
I
appropriate.
think you can stop, Ma. To save time, we'll stop it here. Most
Okay.
complaints arise from communication breakdowns, unmet expectations, or delays in care rather than clinical competence, clinical errors. Rather than means, what is the meaning now? Which is right? Most complaints, most common cause. Most complaints arise from is the synonymous expression of most common cause. Complaints arise from communication breakdowns and unmet expectations, right? Communication problems and unmet expectations. So do you need to read all these things?
No.
No, Father.
Yeah. Then how do you say there is no time? First instance, absolute Skutaten principle came and helped you. The robotic help was there. Then only two options were there. And somebody commented saying that if there is a conjunction,
That will be the
that
answer.
must be the answer. And once you're competent, you can just try take this answer and go. Then when come back and just verify if you want those doubts if you have. Okay? But once you are competent, you will not have doubt. Don't believe us that we told you to eliminate. No, you have to get it through practice. That's why I'm showing you. Somebody is asking, is it applicable to all? Let's see whether these are applicable to other questions as well. That is clear, no? Need not read, right?
No. Yes.
It's
Yes.
clear.
Yeah.
Next one.
Right. Next one. According to the text, which statement best reflects the use of telehealth in primary care?
Best to reflect.
This
This reflects.
Best to reflect.
Best reflects. Best
Okay.
reflects.
Option A, telehealth is always appropriate for managing chronic conditions.
Always good.
Always.
Absolute, Father.
Absolute. Eliminated.
We can eliminate.
Yes. Yeah, if you command me, I will be obedient. Yes, I eliminate. If there are beginners, don't believe these people, okay? I don't believe them. You don't believe. Only with practice, you have to confirm, okay? Yeah, eliminated. Telehealth can be useful, but is not suitable for all situations.
All absolute.
No. It is not eliminated. No.
There is some objections about all.
Can be.
Is it absolute?
No.
No.
Meaning is
Not suitable for all situations.
Not
Means?
Suitable for some situation.
Yeah, suitable for some
Situation.
situations. Some is not absolute. Meaning must be absolute expression plus the meaning of the statement must be absolute. That is the first exception. See, telehealth completely replaces the need for physical examination.
Completely.
Absolute.
Absolute. Eliminated.
Yeah. Since somebody commanded me, I am obedient servant, eliminating it is. Yes. Option D. Telehealth should only be used when patients request it.
Only.
Only.
Absolute.
But not.
Telehealth should be used. Telehealth should only be used when patients request it. Should I?
Yes.
Eliminate.
Eliminate.
Your obedient servant. See how they play the tricks here, you see? All four have absolutes, but one meaning is not absolute. Where is Ganesh? Mr. Ganesh?
Sir. Father.
Such a interesting thing, simple thing, easy thing. We don't even read the text. We don't even look at the text.
Yes, Father.
Then how can you say it is frustrating? It is difficult. Okay. Thank you, Ganesh. I am seeing you in the main platform, helping the platform, giving spam alerts and all that. All can imitate that. Okay. Whenever you see a spam coming there, just give an alert. If 10 or 15 people just send an alert, you can keep somewhere copied, pasted, typed and pasted. That alert you can send here, copy and paste here with all the heads and breaks and all, so you suddenly go away. and new beginners will be alerted. That's not from EduSkills. In spite of all our what you call boards and other protections, tech team struggling, still some spammers come here spending lakhs of rupees to break through those protection details because they have to get money. Okay, telehealth can be useful, but is not suitable for all nations. And only here you have one more conjunction, right? Other options, do you have
Yes, sir.
conjunction?
No. Yeah,
Okay, let's
but
see. Yeah, but let's see. As per those principles, this must be the right answer, but I am not confirming it. Let's read and confirm. Yes, come on. Anybody who has a smile.
Telehealth consultants.
Telehealth consultations. Yes, Roja.
Raja, please.
Telehealth consultations in primary care. Telehealth consultations have become an important component of primary care, particularly for patients with stable chronic conditions. They allow clinicians to monitor symptoms, review test results, and provide follow-up advice without requiring in-person visits. However, telehealth is not suitable for all clinical situations. Patients presenting with new, complex, or worsening symptoms may require physical examination to ensure accurate diagnosis. Additionally,
Okay, maybe we will stop. Okay.
okay, sir.
Just to tell you that we don't need to everything. So here what happens if you understand the first sentence, particularly for patients with stable chronic conditions, specifically for these people, not all the people, not suitable for all conditions or situations. That is there. Okay. Telehealth consultations have become an important component of primary care, means telehealth can be useful, particularly for patients with stable chronic conditions. Topic sentence is the paraphrasing of B option. One strategy. If you don't understand that, second one I said, after the contrast word. If there is a contrast word, after the contrast word, you have the answer. What is given here, however, telehealth is not suitable for all clinical situations. Not suitable for all situations. Is that true?
Yes. Yes.
So do you need to read the rest of it?
No.
no need.
Yeah. Then how can you say there is no time? See, here actually, once you are competent, you need not read anything. Now you have eliminated all the three options. Now next your business is only to verify this, right? Option B.
Yes.
Again, I said conjunction. If there is a conjunction in one of the options, that has the maximum opportunity to be the right answer. That works here. Yeah, such beautiful things. So you have topic sentence, you have contrast word, you have absolute, so many. There are around 8 strategies I teach you majorly, and in each question there will be 3, 4, 5 strategies applied. You can use any one of the strategies. Cool. If you don't, that's not enough, use the second one. If not enough, use the third one. Shall we proceed?
Yeah.
So
Yes, Father.
this is the answer. Okay, the B is the answer. I am highlighting and showing it again because in the YouTube comments some have asked for doubts because I did not highlight and show it separately. Okay, after the contrast word, there is answer. If there are beginners, one strategy is that if there is a contrast word, soon after the contrast word, right answer will be given. Okay, what is given after, however, is the right answer, option B. If there are 2 contrast words, normally after the latest one, second contrast word, your answer will be there. How nice and sweet. Okay. If there are beginners, I'll just show you. See, extremes means always and never. The North Pole and South Pole. Okay. And or if you say all and few. Always. What is opposite of always? Never. Okay. Few means 0, all means 100. These are the extreme poles or the absolute words if there are beginners. Some usually you have these words like always, never, only, completely, entirely, all, none. All these are the words used.
Absolute word.
Let's check some more. And some more words, never, none. Okay. Absolutes. This is only for the beginner, so I am just having a glance so that all means 100, few means 0, a few means some. So they are known as the absolute words. And one exception, the meaning of the sentence option is not absolute. We have already seen. Not suitable for all situations means all is there, absolute word is there, but the meaning is different. Not suitable for all the situations means it is suitable for some situations. Some is not North Pole or South Pole. That is not absolute. So meaning must be absolute. Exception 2 is opinion. But you need not bother about it. Even in opinion, absolutes can be eliminated. But sometimes when some people are giving their opinion, you can say, because you are not happy with the treatment you got, you can say all the nurses are very bad. That's my opinion, right? That's not fact.
Yes.
That's someone's opinion. If they use that, and the question is asking what is Saleen's opinion about nurses, that can be the right answer. It's opinion, it's not fact. Factually, absolute expressions are always wrong in medical field. Okay, let's see. Here, one example. Philippe Hujol's comments in the first paragraph indicate that he believes.
Name.
Yes,
Name.
Philippe Hujol's name. Okay,
First
first paragraph for beginners. That tells you immediately go to the first paragraph.
He believes.
Okay, beginners, I have posted the questions here, but in the text, you will have text continuously 1, 2, 3, 4, 5, 6, 7, 8 paragraphs. Then the questions will be there. So that's why you have to, when you say first paragraph, you have to go to the first paragraph immediately of the article, of the text. Okay, indicate that he believes. He believes means his opinion.
Yeah.
He can believe anything. That need not be medical fact, right? Now, option A, no one knows how to prevent plague.
Absolute.
No one absolute.
No one absolute. Okay. Everyone has plaque on their teeth.
Everyone is also absolute. Only also
Everyone is
absolute.
absolute. Only fluoride can remove plaque.
Only absolute.
Only is absolute. Plaque is impossible to remove.
Impossible absolute.
Now you
No.
see.
Your opinion.
No,
Father,
it's
so
hard.
we cannot.
It's hard.
Yeah. Yeah. Since it is opinion, we cannot. Since he believes. Okay, since it is opinion word, opinion question, you cannot, these are exceptions, okay, very rare expression, you cannot eliminate when absolute is there. But I will show you so many examples from the materials that we have already done, maybe more than 50 to 60 examples where you can eliminate. These are rare exceptions. Now, since we cannot eliminate, to locate the answer, what is the criteria here?
Name.
Name, yeah, name. You have to search for the name. Where is the name?
Third line.
Philippi.
Philippe Hujol, third line. Okay, then see all this when you read, you have to all these compliments you simply ignore, don't read.
Third last line.
Third Hujol, this third last line.
Last.
Okay. There is some exactly how fluoride helps when
The 10th line. The 10th one.
Where is it? There is some evidence. It may, he says. Then, in general, experts believe fluoride helps restore mineral, helps strengthen the tooth. Anywhere else? I didn't get you.
The black is inaccessible and you cannot get it.
Visual says. Visual
Yes.
says. What does he say? The plaque is inaccessible and you can't get to it. Similar to any option?
Impossible to remove.
Yeah, impossible.
Yeah,
Impossible to
impossible.
remove.
Impossible. You can't even get to it, right?
Mm.
Then how can you remove? The plaque is inaccessible and you can't get to it. So wherever there is name, just go to just before or after the name.
D.
Okay?
Mm.
Instead of trying to understand everything. And for years, dental professionals, we are not bothered about dental professionals. What they have said, this is dental professionals, right? It's not what he believes. How do you put on clean tooth versus sound out versus those in the first camp? So we not read this at all. Those in the first camp, that's another group. Their opinion there is not being asked here. Say good oral hygiene and remove placing and all those this. See, this need not be read at all. Others argue. Are we bothered about others' argument or opinion?
No.
No. So that is also eliminated. Just for your understanding. All these can be eliminated. Only what he has said, you have to look into. So this is an exception. Exception is 1% in 100 maybe. So don't worry. Again, this could be like I am giving you for those who are targeting 500 marks. Okay? Cool. This is the answer. Yes. Next one. This is impossible for yes. Let's check. Next one. Okay. What does the policy for manual handling equipment tell employers?
Bittu, G2. Kerala.
Employers.
Okay.
Employers tell
Zoom
employers.
meeting पे चल रहा है class.
Please mute when you're interacting there. Please. When you're not interacting, please mute. Okay.
अच्छा ठीक. मेरा वाला तो ज़्यादा डिस्टर्ब नहीं कर रहा है. ये सर हैं, ये पढ़ा रहे हैं और
See, in spite of
Zoom पे
all the
मैंने join कर लिया.
instructions, you're disturbing. You're not only disturbing this classroom. Whoever watches this later on YouTube, they are also being disturbed. They will shout at you. Not only that, it's also your family privacy that's being violated. Then after that, some people come and cry, saying that, Father, please edit it. Please remove that. My husband was scolding me. That is hurt to everybody. It is in the YouTube. Okay. Be aware of that as well. Cool. Yeah, we can understand. Because when your child is with you, mother will have, the child is her world. We understand that. It's okay. We will smile. Okay. Yes. Am I audible?
Yes.
Okay. What does the policy for manual handling equipment tell employers? Option A, all areas of the hospital should be fitted with overhead tracking.
All.
All is
Yes,
an absolute.
All absolute.
No screen.
All is absolute. No screen?
Yeah.
No screen.
Okay. No.
Yeah, came back, yeah.
Yeah, absolute. Should I eliminate?
Yes.
No.
Yes.
Yes, Father, I
Yeah.
have to eliminate.
Assistance devices should be used over physically handling the patient.
Should be.
Should be used.
Oh,
Okay. And see, patients have the final decision on how they should be assisted.
Final decision.
final decision.
Okay. Now, policy for manual handling equipment telling whom the employers. This is patients,
Yeah.
right?
It's blank.
This is
No screen.
yes.
1 second.
No screen.
Yeah, no, okay.
Yeah. Now it's okay.
Okay. Now this is patients. This is assistant devices. This is areas of the hospital.
Yes.
Subject, concept. The question is asking, question Cham is asking, what does the policy tell? Policy for manual handling equipment tell the employers.
Mm.
One speaks about areas of the hospital, all areas of hospital. The second one speaks about assistant devices. Third one speaks about patients. So normally the heading is policy for manual handling equipment means assistant devices.
Yes.
If you have that idea, you know what is the answer.
B.
B.
Yeah, B must be the answer. That
Okay.
is later. When you have when you develop your competency, as soon as you read, you will understand this is the right answer. Okay, let's check it. No, don't worry. Okay, because the heading is important. Heading is speaking about assistant devices, not about patients, not about all areas hospital. What do they say? Tell the employers. Okay, somebody with a smile, please read.
Policy for manual
Manual
handling
handling
equipment. The profession of sealing technology and air assistant patient lifting equipment should be considered as the first line handling aid by employers. As significant evidence exists that their use reduce operator and patient injuries. Overhead tracking should be inserted in all new or refurbished facilities. This should cover bed as minimum, but should extend to institutes,
Suits.
in suits and other area of the facility where patients are likely to require assistance. Once an assessment has been made that equipment should be used for safe patient handling, the equipment should be made available and used even in situations where the patient and or family preference is for it not to be used.
Yeah, patients have the final decision on how they should be assisted is the opposite of, even in situations where the patient preference is for it not to be used. Even if the patient says not to use, it should be used. So option C is the opposite of last sentence, right?
Yes.
Patient has no final word. Even otherwise, you know, patient will not have final word in everything, right? So our assumption was correct. The subject was, that's why we say once you do analysis of the question, from your experience, you will understand when the concepts are different, the right concept, the head, if it goes with the passage or the heading or the question stem, that is the right answer. Cool?
Yes.
See here, all areas of the hospital should be fitted with overhead tracking, but here they are saying overhead tracking should be installed in all new or refurbished facilities. That's not all areas, only in new or refurbished areas. And equipment should be used for safe patient handling, should be made available and used even in situations where the patient or family's preference is for it not to be used. Third option, opposite of third option. Okay. Cool. Next one.
Yeah.
Yeah. The purpose of the notice is to explain to occupational therapists that.
Explain that.
To explain.
Notice.
Okay. Notice you can highlight if you want to know which type of text it is.
Notice, yeah.
Then to occupational therapists.
Yes.
Okay. Yeah. Option A, confirmation of equipment is subject to availability at the time of request.
Time. Okay.
Availability.
Availability. Okay. Second, the mattresses are of standard size, so may not be suitable for all bed types.
May not be
May
suitable.
not suitable.
May not be suitable for all bed types.
You're not in love with this all?
Yes.
Standard size.
Eh? All you are your enemy. Now you don't want to.
Is
Here not absolute, Father. Meaning is not absolute.
And
May
I'll tell you one trick,
suitable
one strategy. If they use an absolute, if the meaning is not absolute, that must be the right answer. These are the tricks they play. That's why I say once you know the strategies, as soon as you see the questions, You will understand, Baba, you don't trick me. I will trick you. Immediately you will say, this is the right answer. Okay, don't conclude it. Let's see. Let us confirm. Option C,
May
patient
not
factors.
also.
May
May
not.
not.
Okay. May not.
Yes.
Let's see. Let's check. Patient factors must be considered prior to lodging a request form.
Must be.
Must be. Factors must be.
Patient factor.
Patient factors. Yes.
Must
Patient.
Patient factors. Okay, let's see. And the trick of it, I told you, if at all they use absolute and the meaning is not absolute, 99.99%, that is the right answer. Okay.
Okay.
Now, another one here. It's speaking about what was the purpose of the notice to explain to occupational therapists. Okay, what is it explaining? Confirmation of occupational subject to availability at the time of request. Matters are of standard size, so may not be suitable for all bed types. Patient factors must be considered prior to lodging a request form. Now, somebody can read with a smile. Whenever you take up your reading practice materials or writing or speaking, whatever, you have to keep a mirror in front of your this one table. I have a mirror in front of me here. You have to smile. Okay, see your smile, enjoy your smile, then start reading. Okay, with every question that will multiply the dopamine cells in our brain. That makes you more focused, motivated, happy, and enjoying. Yes. Come on now, smile and read.
Equipment request form, ERF, for pressure care mattresses. It is the responsibility of the occupational therapist attending to the individual patient to submit an equipment request form, ERF, based on equipment eligibility criteria. A pressure mattress may be appropriate when someone is at risk of a pressure injury as evidenced by documented sound clinical reasoning, and their pressure injury risk is unlikely to significantly change. Environmental and equipment considerations must be confirmed, such as that the patient's weight is within the safe workload of the equipment requested. The size of the mattress must also be compatible with the other bed equipment and accessories, and the patient has been informed regarding the contraindications of placing items. Example, continence products and shapekins. Some comments I can read the last question.
Please. Yeah, on top of the mattresses, only after this confirmation should an ERF be submitted. Okay? Now, the thing is this. If you know the meaning of the topic sentence and controlling idea, if you have seen my sessions on paragraph structure, topic sentence, what is the controlling idea here? ERF is based on equipment eligibility criteria. Equipment eligibility criteria means pressure care mattresses criteria, not patient criteria. It is the responsibility of the occupational therapist attending to the individual patient to submit an ERF based on equipment eligibility criteria, not based on the patient criteria.
Patients, yeah.
Do you get it?
Father?
They're asking.
I can't understand yet. Could you repeat?
Yeah. Now you see the question is the purpose of the notice is to explain to occupational therapists what to explain. So the topic sentence, first sentence is known as the topic sentence in any paragraph.
Yes.
Okay. Normally that is the topic sentence till here, till criteria. It is the responsibility of the occupational therapist. The purpose of the notice tells it, what does it explain to the occupational therapist? There is a notice and it says it is the responsibility of the occupational therapist attending to the individual patient to submit an equipment form ERF based on equipment eligibility criteria.
Based on equipment eligibility criteria.
Not patient criteria, not based on the weight or length or height and strength of the patient, because the mattresses are of some standard size.
Okay.
And you should confirm whether these particular mattresses, which are of standard size, will fit your patient. Do you get me?
See, yeah.
See, again, they are explaining. Patient's weight is within the safe, you should confirm patient's weight is within the safe workload of the equipment requested. Means, equipment is of the size. Patient weight, if he is a heavy patient or fatty, like patient is 130 kg, book another standard size for them. Do you understand? The pressure care mattresses are of standard size. In general sense, in your medical profession, do you submit the patient criteria and the company will produce according to each patient's requirement? The pressure care mattresses?
No,
General knowledge.
No.
From your general knowledge, for each patient, do you give some criteria, patient criteria? Patient is 7 feet long, 130 kg weight, and all those things. Okay, then they give you produce in the factory particular type for each patient.
No, it's not possible.
It's impossible, right?
Yes.
Impossible. So confirmation of equipment is subject to availability at the time of request, and availability. They are not speaking anything about availability. Do they speak about availability of the equipment?
No.
No, nothing is mentioned about availability. Okay.
Yes.
Eligibility.
And patient factors must be considered prior to lodging a request form.
Okay.
No.
Oh, that is not a.
Patient factors.
They are saying, see, based on equipment eligibility criteria, what you have to do, you have to submit ERF based on not patient criteria, but based on equipment eligibility criteria. Equipment eligibility criteria means it says there are 3 types of pressure care mattresses with us: extra large, large, and small. When you buy your clothes, do you give your size standard, your size required, and the company produces for you one chudidar or something?
No.
T-shirts? No, they are of standard
they
size.
They have the standard size.
Yeah, you are maybe maybe for me neither 42 nor 40 shirt fits. For me is 41 is correct. I can't help it. I have to buy either 40 and my tummy will be out, buzzing out, or I have to buy 42 so that my tummy is not seen. Okay? Did you understand the concept?
Yes, Father.
Yes.
Yeah, here you require a little more competency because the topic sentence controlling idea is very important. The whole meaning says they are of the standard size. You request only if it fits your patient.
Okay.
So first you have to take the patient criteria. Then you have to order if it fits your patient. You buy your t-shirt or your dress if it fits you. And if you take all the measurements of you go to a tailor and take all the measurements and go to the fabric store, will you get it? Ready-made wares?
No.
You may not get. They will say, sorry, we don't have this size. Maybe this size will fit you or the other size will fit you. This
Standard size is there, yeah.
Yeah. Is that clear? Don't worry. That's a general competency.
Yes,
when you get a general competency, as you go on practicing, you will get it. Okay. But only what I wanted to highlight is exception. All bed types. All is there. Okay.
Absolutely.
All is
Father.
there. Yes, please.
Hello.
Yes.
Size. So means is it conjunction?
Yeah, again, yeah, I wanted to tell you before that you said it. That is great. The great observation, as I said, if there is a conjunction, definitely so is the conjunction. Okay, fanboys, right?
Okay,
Last
Father.
one is
Yeah.
if there is a conjunction, again, if there is only one option contains the conjunction, that must be the right answer. Let me make it very big.
Okay, thank
Now we got third confirmation, right?
Yes.
That's why I said you don't
Yes.
believe me when I say, but only with the confirmation you have to confirm. Yes, it is. I'm telling you out of my experience for decades teaching English. Okay. So I know it's 100% sure, but don't believe me. You have to practice, and get confirmed. Okay, this is it. I'm happy. Actually, at the end, I wanted to see whether somebody will notice. At the end, I wanted to mention it, but then somebody noticed it. That's a great observation.
Thank you, Father.
Yes. Okay, so this is the answer. Option B. Yeah. Why I'm showing is people should not have doubt. Those who are watching on YouTube later, they cannot ask for clarifications. Do you have some more stamina?
Yes.
Yes.
Yeah.
Maybe we will have a break of for 2 minutes. We will not break. You can discuss with me. By the meantime, grab some snacks because you need energy. Grab some snacks or some. And others who have snacks at hand, always come when you come for OET Live. Because whenever I get time, this time, since we missed one session, I thought of taking a little longer. Okay. Keep connected, mute it, and have your tea. If you want to prepare your tea, you can prepare. We'll give you 2 minutes break. By the meantime, we will discuss here. And if you allow me, I will have tea as well. But then you have to keep discussing because those who are entering new will not know. Those who are here with snacks can keep discussing and enjoying your snacks and tea. Then I can have a cup of tea. What do you say?
Yes, Father.
Yes,
You
Father.
can have.
But I must see that you are discussing. I'll be keeping my headphone. Because some people enter the live there. If nothing is there, they will think, oh, it's over, and they will go out. They'll be disappointed. How about your snacks? All must have some snacks, juice, something, some water at least. Otherwise, you will not have, unless your brain is energized, you will not be able to understand the things.
Okay, Father.
Yeah, have it. I'll be back in. If you have any doubts, keep discussing. Those who have snacks at hand, enjoy it and keep discussing. By the meantime, I'll listen to it and I'll answer you. Okay.
Okay, Father.
Cool. Yeah, give me 2 minutes. Yeah. If you are not interacting, I will not go.
Hey, dear, do you have any idea about the conjunctions? I know and now I know about the so. If anybody have any other information you can share regarding the conjunctions.
Somebody who knows fanboys, FANBOYS, these are the conjunctions.
Oh, fanboys.
Fanboys, FANBOYS, fan.
F is for.
Yes, just find out what.
A is for and.
Fanboys.
N is for.
Fanboys.
Not type.
Not.
B is for but. O is for or. Y is for I forgot. Why anybody? Yet. Yes. YET. Yet.
Yes, it's so. Okay.
It's so.
For and.
Oh, yeah.
N is.
Or and.
N is it what?
N is for 1 minute.
So one N is pending.
N
The
is
rest are
for
correct.
nor, N-O-R, nor.
No.
Nor. Okay. N-O-R. Just no.
Yeah.
Thank you. Thank you so much. First time hearing these things.
So I will confirm, okay? F is for, A is for and, N is
Okay.
for nor, N-O-R,
Okay.
B is for but, O is for or, Y is for yet, Y-E-T, yet.
Okay.
S is for so, S-O, so. Clear?
Okay. It's clear. It's clear. Thank you. Thank you so much. Okay. Then
Any other doubt? Newcomers? Are you all in the main platform?
maybe they just check they are in the Telegram OET International something like that or name right. So you may tell the name. Otherwise, maybe they don't know the main platform.
Means main Telegram
Okay.
group.
Telegram, yeah. So you'll get all the notification, then videos, everything is uploaded there. It will be easy for you. OET Edu International, okay. This is the main platform.
Let me confirm on another thing is nothing means is it absolute or it's not absolute? It's confusing. Nothing. Any idea about it?
It's based on the sentence actually. If the meaning you have to see, whatever the option they've given.
Same like just
Nothing is
before, no?
absolute.
Impossible and all things. Before, like all also depends on the meaning of the sentence. Then only that will be. Meaning should be absolute and
Nothing is absolute, but if the meaning you have to check with the answer options.
We can consider as no like if the meaning is absolute means we can eliminate that
Yeah.
like that. Right?
Yes. Yes. Yes.
So I just collecting the absolute words. So I just want to add on nothing also. Thank you. Thank you.
I have a doubt. If only is coming along with the modal verb, may only, if that is absolute. May only for short term or something like that. I will read one option. Restoration of neurons may only be short term. Restoration of neurons may only be short term. May only is it
that one
absolute?
depends on the text, Lini. If the text, what is the situation? Sometimes some situations may only, happens. Like it happen. May not, may only. It may only. It's not compulsory. May or may not be. No,
Yeah.
that. So in that way only, I think that one. So that can be answered according to the text. In my thinking, Jyoti, what do you say?
Yes, Anita, you're right. May only means you cannot consider as absolute. You have
Yeah,
to
I
read
will.
the text.
I will tell my last session. Father told another example. The answer option says like collection can only take place once their history has been taken. That was the answer. So I think it's the same.
That will
Yeah,
not
we
be
cannot.
that will not be eliminated because it
Yeah.
said there is some reason said like
Yeah,
it
recently
is
last
something,
live.
yeah.
Yeah.
Everything depends on the text really and the sentence meaning.
On that, the topic sentence itself is clear. So don't waste time. We can confirm it. Let me share one new idea I got from father's video about the listening one. Usually, while I listening, I listen throughout the audio. But after attending father's live the recorded video, I noticed the interviewer asking two questions means just concentrate which question is in our question in the textbook. They asking like that. We need to concentrate that particular portion, and then we get the answer. Until I watch the father's video, I always struggle to locate the answer because the video is very long. I cannot concentrate. Once I realize the thing, wow, I really feel like really thank father. Thank you,
Yeah,
father, for that.
so the same as you said, like it's like almost like about, right? It's what about it is talking.
Yeah,
We need to only look into that.
yeah. It's really, I don't know how to tell the happiness because I always struggle with the long video. I cannot concentrate. Sometimes I cried. I don't understand anything. Once I listen that explanation, wow, that's I feel like really I smile with the listening material. Really, thank God for this. No, I choose the video one by one. Because previously I listened the practice material without listening father's class. Then okay, I tried to do one by one from the listening option videos. It's really helpful. Thank you so much. Admin posting every day because every day is so many videos come, so I don't know which one need to choose. But by God's grace, I choose the correct one, and really it's helpful for me. Thank you so much.
Yes, Elizabeth. See, when I also, when I came first, I never heard about any strategies or tips, and never had an idea like how to locate to answer. No, like with what criteria we have to search the answer or what, based on what? No idea. Just reading question, just reading paragraph and searching, for the answer. That was only without any clue. Once started hearing father strategy only, like, one by one we are getting that happiness, as you said. That's really,
So please, how do I join the international group, the WhatsApp group?
WhatsApp group?
Yes, how do I join?
Yeah, we have 5
I think the
communities.
Telegram group, not WhatsApp.
No, WhatsApp, only
No,
Telegram.
WhatsApp group also we have.
Yes, I want the WhatsApp group. The Telegram, my Telegram is
Okay.
not working.
So, you do one thing. Message me personally. I am the WhatsApp community admin. Okay.
So as message you my number.
Yeah. Okay. I will add you. Or
Okay.
my number, you personally message
Okay,
me.
no, I'm messaging you my number now.
Yeah, you are messaging me. Okay.
Okay, thank you.
Okay. You got my number?
No, I'm going to YouTube to message
Here,
you.
in the.
No,
this
I'm going on
one.
the Zoom to message you
Zoom.
privately.
Okay.
Okay, thank you.
Okay. But the thing, WhatsApp community, you cannot, this admin only can message, but in case if you want any urgent thing, you can personally message. Okay.
Okay.
But daily postings will be there in WhatsApp community.
Yeah, okay. I want to really practice, so.
Okay.
Yes. Had your snacks? Are you ready?
Yes, Father.
Yeah. See, all these materials have the tips what we have seen. And somebody has asked, why is emotion-based question absolute is not eliminated? It's not in emotion-based questions. In opinion questions, sometimes, not always, absolutes need not be eliminated. Those are exceptions, okay? Exceptions means 1%, maybe 2%, not more than that. Exceptions. When it is an opinion, somebody can give any opinion. That's their opinion. It's not a factual statement. If it is a factual statement, it can never be absolute. In medical profession, nothing is absolute. That is a principle. Okay? You cannot say a particular medicine can be given to all the patients with the same condition. No. Some will have allergy, or some will have other problems. So from your experience, you know, there is nothing where you can say this particular surgery will heal this condition for all the people. No. In some instance, there will be healing. In some instance, there will not be healing. Right? So that's why the principle is this: in health field, nothing is absolute. Everything is relative. That was the doubt asked in the YouTube comment space. Someone else is for A is talking about communicating sensitive issues in the hearing of the patient, which does not talk about confidentiality. Okay. Somebody is discussing what is on the screen. We have not yet started on the screen. Okay, I was wondering. Yeah, okay. Somebody says option A is talking about communicating sensitive issues in the hearing of the patient, which doesn't talk about confidentiality. Okay. Are you all ready? Then type in ready in the YouTube comment space. You have to give me energy. Okay, my throat is helping me because I am not keeping good health. There is some throat infection, chest infection, and cold. So unless you energize me with your messages, your emojis, and your smiles, in between I'll have to stop. Minnie Jackson
Father,
seems to
one
be
doubt,
exhausted.
Father.
Yes, please.
If they use like modal verbs before an absolute, may only, could only, then is it absolute?
May only, it can be absolute. Most of the time it's an absolute, but sometimes, depends in the whole context, right? As I said, exceptions are there, but then may only help some patients. If you say may only help some patients, means it's not absolute. That's what I'm explaining.
Yes, Father.
If you just ask me all is absolute, these are the absolute words. when used in a context and the statement is absolute, that is eliminated. If the word is used, any absolute word is used, but the meaning is not absolute, that is not absolute. You cannot eliminate. That's what we are saying. We are speaking about the exceptions. Is that clear?
Yes, yes, yes.
Yeah. So, and again, I said there is a difference between question stem and answer options. And there was some doubt to someone asking, Father, there is a absolute in the question stem. You can't eliminate the question stem. You will not get marks, right? If you eliminate the question, you won't get the mark. So that's why I differentiated between question stem and answer options. In the question stem, there are different strategies, tips, and in the answer options, there are different tips. Now we are focusing on the tips only in the answer options. Yes, Ranjini liked it. Good. Yeah. Some smiley is coming. Yeah, I love some smileys. Yeah. Some smiles, some hearts. Yes. Yes, and many assent. Yes. Come on, at YouTube comment space. Send me smileys. Yeah. Dorothy can send more because a crown can be seen. Yes. Yes. Crowning. Yes. Thank you. Thank you. Yes. Yeah. Dorothy's crowning. Crowns are coming. All can buy one crown, one super chat, and so that every day you can see only crowns. Yes. I don't know how much it costs, Dorothy. The tech team manages it. Dorothy, you know how much it costs, one super chat?
Don't know, Father.
Okay. You purchased it, right?
No, it's coming. I don't know how it's coming.
No, Father. Once the most number that who commented most.
Even otherwise, I think 176 rupees that tech team knows, since the platform is struggling with financial crisis to maintain, like tech team has organized it. I think 176. You don't see an option to purchase Superstar? I can't see it.
Yes, Father. There is option. Yeah, there is option also, but this.
Father, here for me it says 10 real.
10 real means how many rupees?
It's 150 rupees.
Okay, but yeah, somewhere around 150, 176, something like that.
Yeah.
Those who want to buy, you can buy and support the platform. Yeah. Once you buy, you will get a crown or something of that sort. This is because she has the maximum number of comments, I believe. There also, when you have a limit, above a limit comments, then you get it permanently without paying. So you can do both. Either purchase it or comment maximum and defeat others and get it on top. Yeah. Let's see who will defeat Dorothy. Yes. Dorothy has a habit from the very beginning. She continuously comments this. And you have seen Shanmuga, admin Shanmuga sending once in a week the top comments, right? Who is topping now? I think it was Manju, I think. Last week, more than 600 comments, something like that. Okay. Oh, Dorothy says nobody can defeat me. She is, yeah. Yes. That's great. She earned it, right? That's great. So simply comment, like all the videos in the YouTube comment space, you will get it. Okay. You don't lose anything. Then it looks nice. Energy booster for me as well. Yeah. Come on, smile. We are going into the question. Hope you have some energy. The memo about the use of smartphones during surgery tells staff that. Come on. Hello.
Hello.
After snacks. Yeah. Not audible.
Smartphones.
Okay. Use of smartphones. Okay. And those who are in the YouTube, you can type in. Okay. Type in the comment space as well. Yes. Anita Taj and Dorothy is competing for the crown. Yeah. Tells staff. Okay. Tells staff. Sorry.
It's about question.
Highlighter is not. Tell staff. Okay, option A, their use may be a violation of patient confidentiality.
Violation of patient confidentiality.
Violation
Maybe
of
patient
patient okay.
confidentiality.
Option B, they are to be used only by the surgeon.
Only eliminated.
Yes. Whoever it is, she is very strong. She is very angry with the absolutes. Suddenly she says, eliminate. Yes. Good. That confidence you should get. Yes. They can, see option C, they can potentially lead to patient harm.
Patient harm.
Patient harm. Yes. So you have only two options, right? You have to see whether a violation of patient confidentiality or patient harm. Yeah, somebody with a smile, please read.
Memo restricted use of smartphones during surgery. As smartphones technology has become increasingly common, it is now a cause for concern when used within the operating rooms, especially as a major source of distraction. For this reason, the use of smartphones within the operating room will now be restricted. The undisciplined use of smartphones, whether the telephone, email, or data communication, and whether by surgeon or other members of the surgical team, may compromise patient care. Whoever possible members of the operating suite
Do you need to
team
read?
should
Continue? Do you need to continue reading? No?
No,
Here
no, Father.
may compromise patient care. What does it mean?
Can potentially lead to.
Okay, let's see. You can continue reading. Since all I haven't got clarification, let's read and eliminate other things. Okay, read, continue reading. Whenever possible?
Okay, whenever possible, members of the operating suite team should only engage in urgent outside communication during surgery. Personal and routine calls should be minimized and kept as brief as possible. Incoming calls should be forwarded to voicemail or to the reception desk to be communicated promptly. Any use of a device or its accessories must not compromise the integrity of the sterile field, and special care should be taken to avoid sensitive communications within the hearing of awake or sedated patient.
Okay. So what is the answer?
C.
C.
Sure?
C.
Yeah. What does it mean? Must compromise the integrity of the sterile field? It will harm the patient, right?
Yeah.
Whether by the surgeon or other members of the surgical team may compromise patient care. Does it speak about patient care? Does it mean patient harm or patient confidentiality? Patient harm. So here itself you have this one, whether by surgeon or other members, that eliminates this only, no? They are to be used only by the surgeon. That says whether by surgeon or other members of the team. It's not only by surgeon. Again, their use may be a violation of patient confidentiality. Here, they are not speaking, and special care should be taken to avoid sensitive communications within the hearing of awake or sedated patients. Okay? What does it mean? Does it mean speak about confidentiality, patient confidentiality? No. It's saying then doctors and health workers, when you communicate something about the patient and their treatment or those things, they may be half sedated or they may be hearing it and it will harm their confidence, right? So that's nothing to do with patient confidentiality. So this is clear, right? They can potentially lead to patient harm. And our business here is to say that these absolutes are very, very often used. Okay? In the official materials, if you use unauthentic materials, they will not be there, strategies will not be there. The problem is that 60 to 70% of the material available in the social media is unauthentic, produced by anyone and everyone, and being sold at high costs. Okay? 20 materials, 4,000 rupees. Pata. But that will kill your competency. Shall we move?
Yes.
Yes. Next one is, so the answer is C. Next question. The main point of the extract on subcutaneous cannulas is to explain.
Subcutaneous cannulas.
That's the theme. To explain. Subcutaneous cannulas is the heading, right? That's the main topic. You can highlight if you want that also. You can highlight, no issues. The main point also is important. Yeah, main point is important. Okay. Option A, the versatility, right? Versatility of the design and function.
Versatility.
Okay, versatility. Or the main thing?
Design and function. Design and function.
Design and function. And there is something more main in that.
Conjunction.
What is
Conjunction.
Conjunction.
Yeah, if there is conjunction, that much is the answer, they say. Okay, option B, that they must only be used by registered nurses. See, modal verb is there, must only is there.
Absolutely.
Yeah, and somebody was asking whether it is absolute when it comes with modal verb. This is absolute, right?
Yeah.
Eliminate it. Okay. Then option C, the need for a backup cannula is in case of malfunction.
Backup cannula.
Okay, backup cannula. Backup cannula, yes. Now you have to see whether does it speak about design and function or backup cannula. Okay. And the heading is
Subcutaneous
cannulas. And if you know the significance of a heading, that will never speak about a backup cannula. Because before they may speak, but before that they have to speak what subcutaneous cannula. That is the heading. That is the important thing. The topic sentence will start explaining that particular thing. Then only they will speak about additional things like backup cannula. Backup cannula is additional, right? Not the primary. Secondary aspect. Do you understand the difference between primary and secondary aspect?
Yes.
Primary medication and secondary medication. Okay. What you call life-saving methods are the primary medication. What do you call it? I don't get that word. First aid. First aid is primary, right?
Yes, sir.
Then
Yes.
other treatments are secondary. First, you have to, when there is an accident and the patient is serious, you must think of some first aid. Or you have lifted somebody who was drowning, then you have to think of the first aid. That is the primary line. Okay, let's see. Who has got a powerful smile can smile and read so that the screen will not black out. Nobody has smiled, then I'll stop.
Subcutaneous cannulas.
Okay. Sorry, that person has internet issue, okay? Somebody else. One who is reading now has internet issues, not audible.
Subcutaneous
Subcutaneous
cannulas.
cannula is a small plastic tube designed to carry medication in a person's body. One end
Now this
inserted by a
is,
registered
one sec, give me one chance. This is known as the topic sentence, first sentence. Do you see any familiarity or synonymity or Familiarity with
Yes,
any of the
Father.
options. What is it?
A, option A, design and
Option
function.
Yeah, subcutaneous cannula is a small plastic tube designed, and the function to carry medication into a person's body. That is the function, right? To carry medication. How nice, how sweet. Now the challenge is this I am facing. Now in the initial episodes, I have given repeatedly the paragraph structure. People don't want to read it because they are not directly helpful materials. If you understand what is a topic sentence, all the paragraphs, all the questions, give a hint. You get a hint from the topic sentence. Once you have that competency, you need not read rest of the things at all. Do you get me?
Yes, Father.
Now they are
Excuse me,
explaining
Father.
this. Now they will be explaining the design and purpose. Yeah, read one end. Please read it. Continue reading. We'll just
Father,
read. Answer we good. Yeah. No. Please. So one who has got children around you, please don't read. Others, please.
Father, can I leave, Father?
Yeah, please. Yeah.
Okay, thank
Others
you.
who are here, please. Yeah, those who are leaving need not ask me permission. Okay. Yeah. Come on. Nobody wants to read.
One end inserted by a registered nurse. Uh, it's just under the person's skin. The other end divides into two parts and is shaped like a Y. One part of the Y arm can be connected to a syringe driver or infusion pump. The other can be used for subcutaneous injection. The nurse may insert a second cannula in a different part of the body. This is in case
Yeah. Now they are second portion. They are speaking about backup cannula, second cannula. Is that the main point of the paragraph?
No.
No. They are also saying the nurse may insert. It's not must. It's not main point. It's a secondary thing. Here you see one end sits just under the person's skin, the other end then divides into two parts and is shaped like Y. All this is speaking about design, right?
Yes.
The other can be used for subcutaneous injections. That is a function.
Function.
So the whole this portion is speaking about this topic sentence, explaining this topic sentence. Nothing else. Okay. Topic sentence gives you nurse, and this is secondary information. May and how can it be used? You need not read all those things. Out of 800 words in the text, you need not even read 300. Less than 300 you need to read if you know the strategies. Any doubts? They are asking main point. That is important, not secondary point. This type of questions very often happen. And one only is there, absolute is there, you eliminate it, then you have only two options. Then again I said and is there, conjunction, if and is there, 99.999%, that will be the right answer. Do you agree?
Yeah. Okay.
This is the fourth example. I did not select, I did not even see those conjunctions. Just now when I go through, I realize there are. Don't believe me? From your experience, you have to practice, and from your experience, you have to learn. Okay. Shall we move on?
Yes, Father.
Yes.
No smiles, no sound. I will stop, I believe. Okay, this is from part C. Let's see. The Cancer Council advises that.
No screen.
No screen? Because you are not smiling.
Yeah, no.
Yeah. Now we can see.
Is it okay?
Yes, Father.
Yes.
At YouTube? Okay. The Cancer Council advises that. Hedging words?
Cancer Council, the
Cancer
name.
Name. Advices. Okay. Option A. There are many health benefits of alcohol.
Benefits.
Health benefits.
Benefits.
Health benefits. Option B. The benefits of drinking red wine to prevent or treat heart disease is conclusive.
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 The evidence that alcohol can prevent or treat heart disease is inconclusive.
Inconclusive.
What are they?
Straight opposite.
If straight opposites, what happens?
One of them, it is the answer.
So what is the
Remaining.
impact? Other two
Other
will be immediately eliminated. You need not read.
Okay.
Okay. You can prove. I just eliminated. You can say, Father, you are wrong. Okay. When you read, come on now, read the text with a smile. Powerful smile. Yes.
But what about the heart health benefit of alcohol, where the evidence is inconclusive and
Yeah.
potentially
Stop. Topic sentence.
is inconclusive?
Any clue?
The
Answer.
The evidence is inconclusive.
Yeah.
Answer.
Option C, right?
Yeah, see, yeah.
Then do you need to read rest of the text? It's clearly stating, right?
Yes.
Sorry.
Yes.
Yes. Clearly stating the benefits of inconclusive evidence is inconclusive. The evidence that alcohol can prevent or treat heart disease is inconclusive. Okay.
Yes.
Okay.
There is some doubt.
No.
We'll read. Don't worry. We'll read if there is doubt. Now you see, and potentially flawed. At present, evidence is flawed. Flawed means not clear. The Cancer Council says, adding that the National Health Foundation advises. Do you require the advice of National Health Council?
No.
No, because we are asked about Cancer Council. Okay. Against against the type of alcohol, the message to consume there is no evidence suggests there is safe level of. The message to consumers is that there is no evidence. Even that says no evidence to suggest there is a safe level of drinking which comes to cancer. Okay, this is not required because we are not bothered about the suggestion or advice of National Heart Foundation, but we are concerned about Cancer Council. However, given that the risk increases with the amount, the Cancer Council suggests. However, is there, right?
Yeah.
So what to do? Now, this answer is in the topic sentence. Now, however, in this portion, the next question, which we are not dealing now, answer is here. Next portion, next question. Next question is about the safe level of drinking. Do you understand? There are two questions from this paragraph. This second portion answers the next question. And we don't require this National Heart Foundation because the name is here, Cancer Council.
Yes.
When somebody is asking what is the message from Regina, should you look for what is the message from Rebecca? No. But what about the heart health benefits of alcohol? Heart health benefits of the alcohol. The evidence is inconclusive. The evidence that alcohol can prevent or treat heart disease is inconclusive. Paraphrasing. Is that clear?
Yes, sir.
Now there is a contrast word, but there is one more question from the same paragraph. The answer is below. This one, no more than Answer will be no more than 2 drinks a day. We are not dealing with it now to save time because this is the answer for the next question.
Excuse me, if I can ask a question?
Please.
Why D it is eliminated from the
Which
start?
one? Which one?
D.
D is eliminated because, see, this one, B and C are quite opposites, right? Conclusive. Evidence is conclusive, evidence is inconclusive.
Yes.
Okay. The elimination principle says if there are two options which are opposite to each other, the other two will be eliminated. One of them will be the right answer.
Okay.
That's the principle.
Okay. Thank
That's why we have eliminated. There is a safe level of drinking 1 or 2 standard drinks a day when it comes to cancer. That is a D option. Do you have that answer somewhere? However, given that the risk increases with the amount, the Cancer Council suggests that anyone who wants to drink should stick to the National Health and Medical Research Council guidelines, no more than 2 standard drinks a day for healthy men and women. A standard drink is 2 drinks a day is for whom? Not for cancer patients. See, option D is saying about safe drinking for safe level of drinking when it comes to cancer. For healthy men and women, a standard drink is usually discovered by all those, but it can vary depending on the alcohol content of the beverage. And this is again, what is this? There is a safe level of drinking 1 or 2 standard drinks a day when it comes to cancer. Who is saying that? Who is saying it?
National Health and Medical Research Council.
The question is asking about whom?
Cancer Council.
Okay. So do we need that for this answer?
No need.
No need.
Is that clear? Why did we eliminate this? Because these two are opposites. Which one? These two
It's
are
clear.
These two are opposites. B and C. These are opposites. Option B and C. That says even if you don't read A and D, they can be eliminated. Don't believe me? But when you read the passage, if you get confirmed, it's cool. Here it says the evidence is inconclusive. That is option C. Is that okay? Then this is eliminated, right?
Well, the option D is confuse us.
There is a safe level of drinking 1 or 2 standard drinks a day.
When it
1 or
comes
2. When it comes to cancer.
Yes.
When it comes to cancer, that means when it comes to cancer means when you have cancer.
Mm-hmm. But
Okay.
he said National Health and Medical Research, no more than 2 standard drinks a day.
No more than 2 drinks means maximum 2 drinks.
Yes. Like
okay.
option
Yeah, who is saying that?
National Health and Medical Research Council.
And now the question is asking, what do the Cancer Council advise? There are 2 organizations, right?
Yes.
There are 2 different organizations.
Yes. Thank you.
Here you see Cancer Council says.
Yeah.
Says means advises. That's the importance of name. I think I have uploaded 10 small videos about explaining the importance of name. Name of a person, organization, institution, organ, this condition, whatever the name. If it happens in the question stem. Okay. This is what he says. Well, the evidence is inconclusive and potentially flawed at present, the Cancer Council says. Okay?
Father, can I ask some Anita here? Father, that D option, there is a safe level of drinking. It is saying no, but in the subject complement, when you highlight line, it is written there is no evidence to suggest there. So that is opposite also. Otherwise, the D option. From the compared to the text, there is no evidence, but the D option saying there is a safe level. The otherwise in the text says there is no evidence to suggest there is a safe level of drinking.
Where is it? There is no evidence.
In the middle, the middle
the
line.
message that you consume is that there is no evidence. Yeah, there is no evidence to suggest there is a safe level of drinking when it comes to cancer. You mean this one, right?
Opposite, right, Father? Opposite for the D, right, Father?
Yeah, yeah. No, yeah, exactly. Want to ask the question, do you get it? There is no evidence to suggest there is a safe level of drinking when it comes to cancer. But the option D says, what does it say?
Option D says there is a safe level of drinking. Yeah.
There is no evidence to suggest there is a safe level. And option D says there is a safe level of drinking. They are opposites, right?
Yeah. The first one is Father's strategy, straight opposite. Otherwise, this is another.
Yeah, if you want explanation, yeah, definitely. The text says there is no evidence to suggest there is a safe level. Text says there is no safe level of drinking. Okay? Who is saying that? National Heart Foundation advises. But here it says we are not bothered about National Health and Heart Foundation, but we are bothered about Cancer Council. But even if you take that, that says opposite. There is no evidence to suggest there is a safe level of drinking, whereas option D says there is a safe level of drinking, which are just opposites. That's also second explanation. Is that clear? One word dead out?
Yes, clear.
I think everybody is tired.
Yeah.
Yes.
Exhausted? Then we will stop.
No stamina to go.
No.
No stamina to go.
Yeah, let's see. Let's see. I'll stop sharing and let's see who all are there. What's happening? Let me have the smiles. When I see such interesting texts, I don't get exhausted at all. Huh? That's why I ask you to keep something ready at hand, some snacks, some juice, some tea, to help you get energy.
Father, I shared one question in your Telegram, Father.
Now?
Yeah. Someone posted before in main platform, but there was no answer key. But the middle B is marked.
If there is no answer key, don't bother. Just ignore it, okay?
Okay.
Without answer key, we don't respect the posting at all because authenticity is always in question when there is no, and also spammers do that just to confuse you and to convince you that strategies won't work.
Okay.
So we don't respect all. So never ever try to practice what you call materials without answer key. The first signal that is not an authentic material is there is no answer key. So don't post it, don't practice it, because there is plenty of material in the main platform file segment or in the application or in the batch groups, plenty of materials. You don't require more than that. Then why should you go for unauthentic material? So whoever, just admins also mind, whenever there is no answer key, please don't respond to them. Only response is that material to be authentic, to respond, there should be answer key along with the material.
Yeah, last day Minnie already messaged. She put the message in the group that without answer key, no need
Yeah.
to.
So please don't use such materials that will kill your competency. Otherwise, I would have discussed. There is no answer key. You will have to check for the authenticity. Next time I'll see if there
Okay,
is.
fine. This question I think we had done one time in our some practices, but
Yeah. Again, without showing it here in the screen, people will not understand. I'll have to
okay.
copy it. Yeah. I'll check, and if need be, next session I'll explain. Anything else? Always see that you practice authentic materials.
Other than that, Father, the Telegram main platform link as well as WhatsApp group link I posted now in Zoom.
Okay.
Because someone asked about joining.
Right. Yes. You can post it everywhere, no problem. Right. Any other questions? We'll see how many have the stamina just in the YouTube comment space. You can just post if you have stamina. Though I am sick, I have stamina, no worries. So always we are not able to come. If somebody wants to join Zoom, those who are not there in Zoom, if you want to interact, you can join, no issues. So I have posted the link in the main platform again. Yes. Just let me know at the YouTube comment space if you have stamina. If there are more people, we'll go on for some time, some more explanations. Otherwise, we'll stop some discussions and yeah. And maybe one check I'll show you about the materials. Okay. Those who have asked me about materials, where do you find materials? Where do you find materials? Let me check. Yeah, where do you find materials? In the main Telegram group, you can click on the link, Let me check if I can show you that. Yeah, how to get materials copy. Let me check if I can show you here. You can take a screenshot and keep if you do not understand. If I can paste it here. Okay, how to get materials? I am posting the message which is being posted. Regularly in the platform. Okay, the materials for reading, listening, speaking, and writing modules are available in the main platform group itself. Main platform group means OET EduSkills International. OET EduSkills International. And you can just go to the main icon. How to access it? You can just go to the main icon. Main icon means on top of where there is name now, usually seen in blue color on top of this group, EduSkills International. Then click on the file section. Then search for which material you require. Then download, practice with your preference. Okay. Then download. If you can't find it in the music session, just go to the EduSkills YouTube channel. There is something missing here. If you like for the listening, you have to go to the file segment and find the questions and the script. You have to go to the music segment. Same date, you just search the same date, you will find the audio. Okay. When otherwise we are posting every day, we are posting about 20 full listening materials, audio, and later with video and all those things, practice materials we are posting, which is more than enough for you for practicing. Is that clear? Yes. I think it is also explained in one of the episodes. I don't remember which episode. In the systematic episodes I have explained. Okay. Then batch groups. You have materials in the file segment of the batch groups. Okay. Then discussion group. Definitely all the daily discussion materials are in the discussion group as well as in the file segment. Daily tasks given. Every day in the main platform, daily task is given. If you scroll back, you can find all the materials. Edu Skills application. We are now updating it now. Ebook. We are almost about to publish it. We are working on it. As of now, it is not published. We are working on the final aspects, and we have given it confidentially to some people. Because they are contributing to it. Whatever the volunteer contribution we are receiving, just for the publication of the book, just for the cost, maintaining the cost, working cost, because some tech team is working from outside for compilation of the book, correction, and script writing, editing, and all those things. Yeah, those who cannot afford, definitely you need not contribute. Will be, once it is published, it will be free for everyone. For those who are willing to contribute something, you can definitely send us a message. Send admins a message or anyone. They will give you the details. Yes, but then make sure that it's going to a team, working team. The contributions. Make sure that you send a screenshot to us, to my WhatsApp as well. Yeah.
Doctor, please, when are we going to discuss some of the questions that you have to go to the paragraph and look for the meaning of the words? That type of questions.
Yeah, we will be like
they
next
ask, what does this?
No, actually, since people have no stamina, otherwise, now see, once we have finished this, I'll just come. I have prepared the whole material, like 15 to 22. You know, see, this contains everything. The RCD. Are you able to see my screen?
Yes, please.
Yeah, like maybe in the next session we'll continue it because people have no stamina now. See, after completing this, we have to go to the whole set and find these same strategies there. I'll just show you. One sec. We are also supposed to practice some listening as well, but today, when you are exhausted, we can't do it. Can you see my screen?
Yes, please.
Yeah. Now we are supposed to do this one, but then, I don't know, depending on the stamina. See, this one, this will have all the questions, all types of questions, everything, all explanations. This is text 2 from a reading material. Somebody has sent me. Like, every question will be explained. 15 to 22. So you will have all the explanations.
Let's do it.
Okay.
Mm-hmm.
I think we should schedule this for a day so that we can do the whole thing.
Yeah, we are supposed to do today, but then, you know, people are like, maybe they have come after duty and all that. We understand. They have difficulty. No, exhausted. There's no meaning in doing when you're exhausted. Otherwise, I prepared all this yesterday night. This full material. It was sent by somebody saying that it's challenging, but it's not challenging. Okay. That is question 15 to 22. We'll be doing it. And we have done, I think, more than 30 materials, full materials. Sessions are uploaded. You can watch. Every explanation is there. Reading materials, maybe we have nearly 380 recordings uploaded in the EduSkills OET YouTube channel. Almost every material, authentic material, which was available is being explained. And whatever the aspirants has sent me asking for explanation, we have explained. And we are making an ebook of it. In a short time, we'll be publishing it. That's what I said. If you need the pre-publication copies, you can send a voluntary contribution and get it. If you're not working, you can just let me know. We will give it free. But that's not to be published because we need to work on copyright issues and other things. Final corrections are going on. Yes. That's a clarification for those who are asking for ebooks. Anything else? If you have any concerns, you can ask me like that.
Father,
Yeah.
Father, shall we postpone today's discussion to tomorrow?
Discussion, yeah, definitely. What time is your discussion? 5 o'clock, right? Again, back to 8:30?
8:30.
Okay. Okay.
We planned to postpone, but till now we decided.
Pardon?
We planned to postpone, but till now we didn't decide further.
Okay, if you want, you can postpone. No problem at all. That you can decide and do. No to ask me at all. It's for your convenience because I don't know how it is going and like who is what. And if they are attending here, it will be too long for them, no?
Okay, Monday, Father, please enter to the discussion and correct us.
Yeah, definitely. I will come. Yeah, sometimes you send me a reminder, discussion reminder. Okay. Okay, because two hectic things. Yeah, two hectic things. Sorry, please. There is some instrument need to be muted. I'm getting. Because I don't know how it is going and like who is what. That second instrument. Please mute the second instrument.
Okay, sorry, Father.
Yeah, definitely. It's okay. Please mute the second instrument. Sometimes you send me a reminder, discussion reminder. Yeah, mute it. Yeah, okay.
I've done that. Very
It's
sorry.
okay. It's cool. We understand, no problem. Sometimes beginners will not understand how to handle the instruments. Yeah, cool.
I do.
And
No worries.
yeah, it's okay. We understand. I mean, it's okay if it is between the explanation, no, it will be like disturbing everybody. Now this is interaction time, no problem. And at the YouTube comment space, you can send your
Thank you, Father. This is my
You're welcome.
hello.
Yeah.
Thank you.
Please.
This is my first time. I really appreciate the class. Thank you so
you're
much.
most welcome.
Yeah.
You're most welcome.
Yeah.
Yes.
Yeah.
Anything
But I
else?
still need
Anybody?
I still need more clarification about the absolute. I'm still a bit confused because it's my first time.
You just go to EduSkills OET YouTube channel, type reading part C or reading, just write OET reading / absolutes or elimination. Elimination. You will find elimination, and also you will find so many examples. Maybe I can show you here in elimination method 1 video. I have given 1 sec. Let me check if I can show you here.
Okay, thank you.
I'll show you here. One link is there. If you want to read further on elimination, one ebook link I can provide you. It's a free ebook.
Oh, thank you.
Let me check. I posted it somewhere here. Even elimination method, there is a video itself.
Okay.
With the title elimination method. Even if in EduSkills OET, if you go and type elimination method, you will find that video.
Okay.
1 sec. Let me check if I can find that ebook. See, this is the title of that video, thumbnail, elimination method 7 skills. Okay.
Okay.
Let me check if I can find. See if you can copy this. You want these links? I can
Yeah,
post
it's
it.
not clear.
I'll
Okay.
just post it in the YouTube.
Okay, in the
comment
WhatsApp
space.
or
You can,
Telegram.
no,
Okay.
just in the YouTube comment space. You can save it from there or copy it from there.
Can I copy this thing from here?
YouTube comment space. I have posted the link to one video. One more video. I don't know which videos these are. One more video is here. One of them will be the elimination video. Are you able to copy?
I'm trying, though it's not too clear.
Yeah, even you can click and play, so no problem. Or let me check if I can play here. Magic trick one. Okay, one sec. I'll go back and play it for you, maybe. One sec. How to enhance the audio. Where am I? Share. Share, optimize for video sharing. Cool. Yes. Can you see?
Yes.
Definitely you can eliminate. And verbs and adjectives.
Is that visible and audible?
Yes, I can see the link.
No, this video is not visible, right? Audible, right?
No, Father. Only that first
No, Father.
screen.
Okay, one sec. Let me go to YouTube. Window. Give me 1 minute. See at YouTube comment space, if you search like this, elimination method.
Yeah.
Elimination. See, you'll find part B, part C.
Okay.
One sec. Yeah. You can find many eliminations of the videos. See one, this one I said. Okay. Then part C elimination, part B elimination, part C elimination. Let's check one. Let me check if we can hear it. Sample 3, text 1, allergic to eating. Thank you, OET, for allowing me to use this. For how to summarize the text or the paragraph in your own words. Try Is it audible and visible?
Yes, it's visible.
Yes.
Okay. Nature of the language, you can eliminate most of the options. Step 7, confirm and mark the correct answer. Okay. Welcome back to EduSkills. So it remains easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. And this is how you will deal with today's text. So step 1 is analysis of the question. Identify the hedging words or keywords. Hedging words means keywords, okay? Don't confuse if I habitually say hedging words, that means keywords in the question stem and answer options. Now come on, let's see. Shout out and just tell me what are the keywords you can put in the comment space. At Zoom, you can shout out. This is the 7th question. The case of Lucy Smith highlights the fact that food allergies.
Name Lucy Smith.
Name Lucy Smith.
Okay, okay, Lucy. Yes.
Fact.
Fact.
Okay. First option may be difficult to diagnose in certain people. What is the concept in this option?
Difficult diagnose.
Diagnose. Yes. Concept-based hedging words, we call it. Concept-based keywords. And B are relatively rare in the adult population. Rare. C option can cause debilitating symptoms. Next one, often require urgent treatment. Yeah, treatment. Yes. Option A says diagnosis, C says symptoms, D says treatment, and relatively rare in the adult population. Can you give me one word from your medical knowledge? I want one word, like diagnosis, symptoms.
Incidence.
Prevalence, yeah, incidence. Incidence is also a word. Or prevalence of the food allergy issues, cases, prevalence. So they are the 4 concepts. And you can also understand from the, what is this? Maybe, okay?
Model verb.
And maybe difficult to diagnose in certain people, but they are asking about a fact, right?
Yes.
Fact and opinion. So when they ask fact, can opinion be the answer?
No further.
No. No further.
Yeah. Then ultimately what you can do?
Eliminate.
Even before you go to the text, you can eliminate. But don't get confused when you see some of my videos for the beginners. You will find QTA method. Question, stem you have to read. The first line is the question stem. Then you have to go to the text, read the paragraph, then come back to the answer options. If you are a beginner, you have to do it until you gain competency. As you gain competency, you know, maybe 40% of the questions you need not even go to the text, you can find the answer with 100% guarantee. So your question, text, answer. But here we are going question, answer, text. Okay? Because most of you are competent, I presume, with your smiles. Okay? Cool. Now, can cause, can, there is one.
Model verb.
Okay? Yeah, modal verb. And require, what is the modal verb for require? Must, yeah, must. Yeah, synonym of must. So you have words here. So can it be the fact be must, a direction or a mandatory instruction? When somebody is speaking about a fact, I am saying all the OET aspirants at EduSkills are really sweet and wonderful and smiling and loving and hardworking learners. Is there a must?
No.
Is there a mandatory or thing? Yeah. Just stating a fact is different from mandatory statement. You must do it, or you must be hardworking, or you must be smiling. That is mandatory statement. If you take that way, differentiate the things options that way, we have only 2 options left out. Can are relatively rare in the adult population, can cause debilitating symptoms.
Yes.
Second step, identify the keywords repeated in the text. And just match the keywords with the keywords in the answer options. So let's check.
Lucy Smith was strolling through the Canberra last July. Within moments, she could not stand, gripped by pain so severe, she feared she would pass out. The first sign of paralyzing diarrhea, this traumatic episode turned out to be caused by newly acquired food allergy to red meat. food allergies affect 1% of the adult population of Australia. Most do not hit within the same force as Lucy's, but the physical and mental impact can nonetheless turn a person's life upside down and may even be life-threatening. Lucy deduced that she was allergic to red meat, one of the less common allergenic foodstuffs. Only after several further attacks of varying severity was her suspicion eventually confirmed by specialists.
Okay. Now we have this one. One is diagnosis, one is prevalence, means what is the prevalence? Are they all suffering? How many of them are suffering? How many percent you will find? Is it very rare in adult population all over the world? And the symptoms, does it speak about symptoms or treatment? Does it speak anything about diagnosis?
No, Father.
No, Father. So in the first sentence itself, you know, Lucy Smith was strolling through Canberra last July. Strolling means walking. Walking through Canberra is the city in Australia. Canberra last July. So what happened to her? She was walking. Within moments she couldn't stand. Gripped by pain so severe, she feared she would pass out. The first sign of paralyzing diarrhea. So among these four, do you find diagnosis or prevalence or treatment or symptoms?
Symptoms.
Yeah, she couldn't stand is a symptom, right?
Yes, sir.
See how easy in the topic sentence itself you have gripped by severe pain, pain so severe is also a symptom. Okay. Now, what about this one? Are relatively rare in the adult population. Food allergies affect 1% of adult population in Australia. Is it same? The option B says food allergies are relatively rare in the adult population. Text says food allergies affect 1% of the adult population of Australia. 1%.
Generally,
1% means rare, right?
Yeah.
Not many.
Yeah.
Not many. 1%. This is one criteria they create to confuse you in most of the texts. Now, the B option says food allergies are relatively rare in the adult population in India, in Africa, in America, in England, in Germany, in Nigeria, in Pakistan, in New Zealand. It's a general statement. Doesn't say where it is. Are relatively rare in the adult population means the whole world, right? It doesn't specify. But the text is saying adult population of Australia. This is a technique they commonly use. How does it sound? Did you understand?
Yes,
Yes,
Father.
sir.
Hello? Can you hear me?
Yes, I'm getting it. Yeah, I'm getting it.
Yeah. And somebody asked me about how to understand the text and how I am explaining the text, okay?
Yes, I'm getting it.
How tricks are played.
Yes.
See, adult population of Australia are
clear, Father.
Yeah. And food allergies affect 1% of the adult population of Australia. Option B says are relatively rare in the adult population. Sounds same, right?
Yeah.
Yeah. Adult population, rare. Food 1% means rare. Very rare.
Yes.
But then of Australia, other one is general of the world. Did you understand?
Yes. Very well.
Yeah. So these are the tricks repeatedly used in the materials. You don't have any unforeseen tricks used in the OET official materials. That's why I explained all the 5 authentic materials using these strategies. And we are building an ebook on that to establish that these strategies work repeatedly in the text. Now, the problem is whatever you do, however you read, now the problem is this, you will understand this as the right answer. Maybe if there is no key, you will understand this is the right answer. You are confirmed, okay. Try a direct answer. Food allergies affect 1% of the adult population of Australia. Food allergies are relatively rare in the adult population. You are confirmed, you are sure that's the answer, but in the examination also that happens. Then you say, exam was easy, but I got very low score, I was depressed. Unless you know these tricks, these strategies, these tips, it's going to be very terrible. I don't know how you will tackle OET. Okay? And if there are at least 20 people daily, I can guide you this way. Okay? Fix a time
Thank
and
you
let
so
me know.
much.
Yeah. It can be any
Thank you
hour
so
in
much.
the 24 hours, except my prayer time, I can make adjustments. Okay? Yeah, continue
Oh,
listening.
thank you so much. I
If
really
there is any,
appreciate.
yeah, if there is any doubt, you can stop me anytime. You can stop. Okay? You can just speak out.
Okay, sir. Thank you so much, Father.
Yes,
Yeah,
Father.
here, this is general statement. Option B says food allergies are relatively rare in the adult population, which means understood in the world. It doesn't speak of any state, any country. But this text is speaking only about Australia. Canberra is in Australia, and it is mentioned adult population of Australia. For example, if you say Kerala has very rare incidence of dengue, and the answer option says dengue is very rare in the population. Are they same?
No, Father.
No. You got the idea, no?
Yes,
You have
Father.
to be very specific because it looks same. At times they give exactly same. The food allergies rarely found in the adult population of Australia. Then you will say, see, B option is right. But this is general statement where his text is speaking about particular country. Okay? And the text, as we said, that doesn't speak anything about diagnosis, right? And maybe also is there, we said even the modal verb is speaking about an opinion, whereas we are asked about fact.
Fact.
Often require urgent treatment. Is there anything about treatment in the paragraph?
No, Father.
Nowhere treatment
Father.
is mentioned. Nowhere treatment is mentioned. Then you know, even otherwise, you know, she couldn't stand, pain so severe, the physical and mental impact can, and this also, again, physical and mental impact can nonetheless turn a person's life upside down. Okay?
Sorry,
So all
Father,
these
please.
are speaking about the symptoms of food allergies.
Father, please,
Is
I
that
want to
clear?
ask a question.
Yes, Father.
And
Yes, sir.
if you remember, if you have attended my previous session, yeah, ask me.
Okay, what if in an option where they will write, now we saw in the test that food allergies affect 1% of the adult population of Australia. Then maybe in the options, let's say in that B, are relatively rare in the adult population in a particular country.
Okay.
So can that also be a correct answer if that
Yeah.
option is there?
If they mention food allergies affect, food allergies are are relatively rare in the adult population of Australia. If they have mentioned adult population of Australia, that will be right answer.
Okay, but I was saying maybe if they did not write Australia, they now mention, just say in a particular country, and Australia is among the tests. So would that answer also be correct?
Yeah, definitely. If the country, they have mentioned in the option the country name, and if the text mentions that country name, that is the right answer.
Okay.
But here they are not mentioning the name of the country. They are saying food allergies are relatively rare in the adult population anywhere in the world. But the text says adult population of Australia.
Yeah.
Adult population of India, adult population of Pakistan, adult population of England. Okay?
Okay. Yes, sir. Thank you.
Yeah. That was about migraine. The first paragraph is exactly like this. Somebody was mumbling when she was reading a news, right? I remember that way. News reader was mumbling. She was speaking something which the others did not understand. And this same type of a paragraph, incident was given and what happened to her, why happened to her, and all those things. So nature of the text, you see, you take any different text, if it is authentic, the nature of text is almost same. Okay, you have only a couple of types of text which I'll be highlighting on Monday's session. Okay, today we are focusing on spending time on the questions. So we are here. The answer is C option, can cause debilitating symptoms. And step 3, identify the contrast word in the text. Focus on what is given after the contrast word. One more clue. Actually, that's not required here because in the topic sentence itself, they are giving the symptoms and other options are eliminated. Still, I am giving you one more clue. Focus on what is given after the contrast word, match with the answer options. What is given after the contrast word? What is the contrast word? The physical and mental impact can nonetheless turn a person's life upside down. Turn a person's life upside down means what? Debilitating means what? Disabling. Debilitating means disabling, making somebody flat. Can cause debilitating symptoms. Means debilitating means disable someone. He is not able to do anything. He is flat. Do you understand?
Yes, Father.
Yes, Father.
So even without this clue, you have found the answer. Still, I'm telling you, if you don't find that, this clue can be used. The clue is this: you usually have the answer after the contrast word. So the debilitating synonymous expression given is turn a person's life upside down. Means if you put you upside down, head on floor, legs up, will you be able to do your nursing duty?
No, Father.
No. So debilitating, disabling. Okay, disabling symptoms. That's cool. One more. Step 4. Now you see, I'll not be doing this with every text. Okay. Yeah, Anitata just got a crown, right? Congratulations. Yes, that was a good sigh. Okay.
Second.
Yeah. Second crown, right? Okay. Great. The other one was Dorothy was first, right? No.
Dorothy first.
Oh, yes. Dorothy first.
Yeah.
So you can compete. You can compete. Others also can compete. Okay. What did you do?
Now I know. Now I just did 110 dirham, one super chat.
Okay. You purchased a super chat, right?
Yeah.
Okay, I can see here. I got the message. It's AED 10, right?
Yes, Father.
Yeah. Yeah. Thank you, Anita. Yeah, you can also purchase super chats. Yeah. Thank you. Great. Nice to see crowns coming. Good. Let's continue. Now I am doing it with one text. You are supposed to take the same test again and do it. That's the way you have to work out. Try to find out all the steps possible. Okay. Strategy 4, summarize the text. Write the text in your own words. Speak out the summary of the text. If you can speak out, if you are a learning partner, speak out. That's the best way to understand. Discuss. Call your learning partner or make a video call and try to speak out, or just speak out in the phone and record it and send it to us. Definitely, it will help many people. If there are corrections, we may not post it, but if there are corrections, we will let you know. And that is another way to connect me personally. Okay, I'm giving you shortcuts, because you are going to teach others. So definitely, I'll be giving you more time because you will be teaching many others, learning from me. So the best way, I invite you, everybody today, take one text and summarize and speak out in your own words. Let there be mistakes. We are all learners. No issues. Okay. How many of you will do that? Just tell me. Yes, type yes if you are going to do it. Any one text, write down the summary. I'll teach you just now how to summarize. Okay. Already I have taught in the previous segment. In the YouTube comment space, yes, Father. Yes, Shanmuga. Thank you. And Ashwadi Ariyan, yes, thank you. Yes. Then Malesh Koruku, yes, Father. Thank you. Please. Others, could you just speak out? Just put on your camera in the phone. Just speak out. It can be casually as you are cooking in the kitchen. You can keep doing something and speak out. No issues. That will give you more freedom and confidence. Okay? Maybe you can start a concept called OET in the kitchen. You can be washing the plate and keeping the phone there and speaking out, this particular paragraph. Don't worry, maybe I'll add the text there, no worries. Otherwise, I can add this particular PPT over there. Okay? You can just speak as if the PPT is there on the screen. And if you have two phones, just keep one phone, the text ready, and speak to the other phone. Okay, keep them one above the other. That will help a lot for you to improve your competency. So summarizing the text. How to do it? All those who do this task and send it in my personal Telegram, just type Saleen in the Telegram, you can find, or 94484413, and send it to me. All those will be admitted to the Zoom, and we'll have a face-to-face interaction next time. How to summarize the text? Now this is the text today we have. Summarizing. First, what is the incident? Lucy Smith was walking through the city of Canberra. Strolling through means walking through the city of Canberra. I am summarizing in my own way. What happened to her? Ask some questions. What to happen to her? The symptoms. She couldn't stand, severe pain, mental impact, physical impact. Then reason. What is the reason? Food allergy. You see, episode turned out to be caused by a newly acquired food allergy to red meat. You can also say food allergy to red meat. Then contrast word, but. Suspected, allergic to red meat. Lucy suspected, deduced means suspected that she was allergic to red meat. Then later confirmed by the specialist. Don't worry about any answer on the text. How nice it is. Now let's check. Now you see, the summary will look like this. You understood? You can work out in your own way in small sentences. You can summarize even in simple sentences. No issues. Don't worry. Okay. Step 5, compare the answer options with the text or the summary to eliminate. Okay. Now, now our business is to compare the answer options with the text. That is step 5. Yeah, we have taken the summary text. So we have to compare these options. While walking in Canberra last July, Lucy Smith was suddenly struck by severe pain. Okay. Severe pain, and left her unable to stand. Unable to stand. I've taken this as summary, okay, which I made. So just to understand, and led to paralyzing diarrhea. Okay, these are the symptoms, right? So we have already done that comparing in the earlier stages. So we don't go into details, and C is the answer. The symptoms already you have. Hope that is clear. This is how it goes, right? Step 6, focus on the nature of the language used and eliminate the wrong answers. Focus on the nature of the language used and eliminate the wrong answers. That is to say, even without going into the text, you will be able to do that. Now here, as I said, fact maybe is the opinion. Then rare prevalence can cause debilitating symptoms. Can means a possibility. Factual possibility often require urgent treatment. That's again speaking about them. The keywords here: couldn't stand, pain so severe, paralyzing diarrhea, physical and mental impact. All speak about symptoms. Now we will check out the options, answer options. So what is this? Question stem asks about a factual statement, but option A is opinion statement. The concept is diagnosis and prevalence. This is what I said. The word rarely you have food allergies in the hostel. Means prevalence is very less. Prevalence and can be debilitating symptoms. Symptoms, the concept, then treatment, diagnosis, prevalence, symptoms, treatment. As you go through the text, you should be able to identify out of these 4 which does the sentence speak about. And one more tip I am giving you, since the first 2 sentences speak about pain so severe, paralyzing, couldn't stand, those are all our symptoms. If the topic sentence, first 1 or 2 sentences speak about symptoms, the whole paragraph will speak only about symptoms. The answer must be symptoms. That's another clue for you. Okay, now you see we have seen that there is an opinion statement. We are asked about a fact. So in that way, looking at the modal verb, it can be eliminated. Looking at the concept, that is diagnosis, prevalence, symptoms, treatment, concept-based hedging word, that can be eliminated. Now again, general and particular. See how many strategies you can use. And option B are relatively rare in the adult population versus of Australia, adult population of Australia. So general and particular. Here General means the adult population in general and adult population of. Are you getting it?
Yes.
Hello. Yeah. Just to see the beauty, as
I'm
we
getting
saw
it.
today, the concept-based, differentiating, hedging words. Now we see first one is speaking about certain people, but the question is asking about case of Lucy Smith, one individual. But the option A is speaking about a group of people, certain people. Second B is speaking about general, whereas the text is speaking about particular country. First one is group versus singular, one person. Second one, singular versus group. These tricks, they exchange. They keep on changing, exchanging. Got it? Hello, are you there?
Yes, sir. Yes, Father.
I'm here.
Yeah. Yeah.
Yes,
See, these
sir.
are the simple things. You have to take the same material or to take a screenshot and work it out again.
Yeah.
Find out all these things, write yourself, circle it, underline it, scribble, and do anything and everything. And see enjoy the beauty. That's why I'm explaining in such detail about each question. That's not only for this particular question. These strategies, tips are used repeatedly in different questions, in every material. But you never realize it, that's all. So first option, I'm speaking from three different angles. The hedging words like concept, differentiating, and the modal verb. See here, first one, the whole thing is, option is speaking about certain people, but we are bothered only about Lucy Smith. Case of Lucy Smith. Okay, when doctor asking you, how is Lucy Smith? Can you say so many people are sick? No. You have to say, well, how is the condition of Lucy Smith, right? So also, second one speaks in general, but we are concerned about Australia. The text is concerned about Australia. Okay, Australia. And third one is symptoms. Fourth one, often require urgent treatment. Somewhere it is given easy about treatment it speaks can nonetheless turn a person's life upside down and may even be life-threatening. Life-threatening means you need treatment. You can understand? You need treatment, but it is may. It says may even be life-threatening. May need treatment, whereas option C says often must urgent treatment. Often require urgent treatment means must require urgent treatment. Okay, you should treat them. You must treat them urgently. So may, again, must. Opinion as well as mandatory statement. May versus require means must. See how beautiful. Why I am pointing out all these things? You have to spend maximum time analyzing and understanding the question stem and the answer options. I've been saying this repeatedly, but people are not doing. You are just jumping from the question to text. On the text, if you are spending 10 minutes, on the question you have to spend 20 minutes in the initial stages. That's how you analyze and understand. So when you have that competency, when you read for the exam, immediately you find the clues and you can immediately mark the answer. Step 7, confirm. Okay, confirming we have done already. That is same.
Father Hanaya's one doubt.
Please.
Can also under modal verb rise. So it can be an opinion.
Can is not opinion.
Can.
He can do it. That speaks about the possibility of doing.
Possibility. Oh, okay, that's why. Okay.
Yeah.
Okay.
Can. I can lift something, you say, no? I can hit you.
Okay. He's talking okay about the possibility. Okay. Okay. Thank you.
Yes. And you want modal verbs? We'll check one. Okay. Let's check modal verbs. This is known as paraphrasing. Every teacher wants to go fast, learn fast. The nature of the text.
Guideline.
Guideline. Exactly. Is this audible and visible? Guideline. That's very important. Only in the initial stages you have to see. After that, you know what is a guideline. Today I'll teach you what is a guideline. You'll find model verbs explanation here. You know from here without reading anything else. What will be the topic? Infection control. And require something. Require means the synonym of
Must.
Synonym of must. And requires from whom? From dentist.
Dentist.
How beautiful. How beautiful. Looking at the question itself, we feel so happy. So you see, 4 things are given in the question stem. Now, there are 4 aspects given in the question stem. If there are very beginners now, freshers, first line, that is known as the question stem, this portion. Question stem, S-T-E-M. Okay? And these are the 3 answer options. We are dealing with reading part B. Okay? Reading part B. Today we are dealing with reading part B. Now, nature of the text is guideline. Topic is infection control. And who has to do something or is dentist. Okay, they must do something. So you are supposed to find out what they must do. Now you see, I said you should be skimming for the headings. Now you see guidelines again. You have here nature of the text. See the connection with the question stem. Okay, guideline. Then you have the topic here in the heading. Infection control. Then you have dentist, synonymous expression, dental practitioners. See, that is called a synonymous expression. Sometimes you have a difficulty pronouncing it. It is synonyms. Synonyms means different words, same meaning. For example, kill, slaughter, assassination, murder. All these are synonyms. Synonyms. Synonymous expression means here you see dentist, dental practitioners. One word is substituted by a group of words, a group of words is substituted by another group of words. Whereas paraphrasing means one sentence using different words put in different way, but the mean same. Those things, both the sentences mean same. Hope you got it. Now, these are known as, what we have highlighted are known as hedging words. When you are not speaking, please mute, okay? Only when you speak, just unmute and speak. There is some instrument which is not muted. I'll be feeling happy if you disturb me. Don't worry. Okay? Come on. Yes. So these are known as hedging words, H-E-D-G-I-N-G, hedging words or keywords. Keywords or hedging words also means main words or theme words. Theme, T-H-E-M-E. Okay. Now, option A, strictly abide by the rules set out within the document. So hedging words are abide by the rules in the guideline. In B, option B, you can shout out if you have no distraction at the background. Use their own judgment when putting the strategies into own judgment. Okay. Third one, follow the example of well-established dental clinics. Examples of well-established clinics. Okay. Clinics. Okay, those are the idea there. Okay. So these are the hedging words. What I was trying to tell you, now you will have to highlight many words, but once you are competent, you will just highlight rules, judgments, and examples. Rules, judgments, and examples. You will understand with that. Now here, what is a modal verb or a synonym of modal verb is used is require, right? And somebody said require is synonym of same as must.
Must.
Now, just glance at the paragraph, just go through the paragraph very fast and identify if there is a must anywhere. You tell me the line number, okay? Number of the line.
Father, individual dental practice must have their own infection control procedures in place.
Which line? Okay. Yeah, okay, one sec. Must, yeah, must. Must is here. As per EduSkills, we teach you saying that if you find a modal verb in the question stem, immediately you have to search for the modal verb in the text. Sometimes a synonym of it, which you will know as you practice. Now you have to see what is there. Must have their own infection control procedures in place. Do you have a synonymous meaning or same meaning in any of the options? Their own infection control procedures.
Must have. Use their own judgment.
Their own judgment, putting in strategies into practice. Is the synonym. That's why I said you do not read anything else in the text. That is the right answer. Strictly abide by the rules set out within the document. Nothing is mentioned. Maybe somebody can just read it if you want a clarification. Read it fast, loud. Only the text.
The routine work practices outlined here are designed to reduce infectious agents in the dental practice environment, prevent or reduce the likelihood of transmission of these infectious agents from one person or location to another, and make items and areas as possible from infectious agents.
Now you see, this is the topic sentence. Can somebody tell me in 3 or 4 words the summary of this? From here to here. Topic sentence will contain the topic. What is the topic? What is the topic?
They are talking about
Reduce
to reduce
the
the in
number
the
of infection control.
Yeah,
the work.
infection control is the topic. In the question heads you have, in the heading you have, the routine work practice outlined here are designed to reduce the number of infectious agents. Okay, reduce infectious agents means infection control. Okay, in the dental practice environment, prevent or reduce the likelihood of transmission of these infectious agents. Again, infection control, from one person to one person, from item to item, from location to location, and make items and areas as free as possible from infectious agents. Means infection control. In 2 words, you can summarize. The whole topic speaks about infection control. The routine work practices outlined here. Here means in this guideline are designed to reduce. Designed to means is designed to is the synonymous expression of purpose. Synonymous expression of purpose. It is the purpose of this guideline is to reduce the number of infectious agents in the dental practice environment or dental clinic. Read in your own way. In dental clinic. Then semicolon, prevent or reduce the likelihood of transmission of these infectious agents from one person to one person, from item to item, from location to location, and make items and areas as free as possible from these infectious agents. Means the guideline, the purpose of this guideline is to remind you or tell you how to control infection or infectious agents. Correct, no? That's how you have to read, try to translate that into your mother tongue, and try to teach your child if you're a small child at home, 3 year, 5 year, 4 year. Okay? You can teach English to them. Put them in small, simple words and say this big sentence means only this. Okay, continue, please reading. So you remember the first topic sentence tells you this is the purpose of the guideline, infection control. Yes, please continue.
It is important to acknowledge that professional discernment is essential in determining the application of these guidelines to the situation of the individual dental practice environment. Individual dental practices must have their own infection control procedures in place, which are tailored to their particular daily routine.
Yes.
Professional awareness is critical when applying these guidelines to the particular circumstances of each individual dental practice. Each dental practitioner is responsible for implementing these guidelines in their clinical practice and for ensuring their clinical support staff are familiar with and able to apply them.
Okay. So whenever there is a guideline, whenever a text speaks, it's a guideline. your question should be, what is the purpose? Means what should be done and who has to do it. These are the only two questions you have to ask and answer. What is to be done and who has to do it? Two things. Here, what is to be done? Infection control. Who has to do it? Dentist or dental practitioners. Is it a suggestion or mandate? Is it a suggestion or must?
Mandatory.
Yeah, so what I'm telling you here, what is to be done is infection control. Who has to do it? Dental practitioners or dentists. And is it a suggestion or a mandatory thing? Must or should?
It's
It's mandatory. Require or must is mandatory. Now I want you to find out the synonymous expressions from the text of what? Not from the topic sentence, from other in synonymous expressions like when you say somebody has to do something, how do you convince him? You will say, it's important that you respect the platform, which means you must respect the platform. And then again, somewhere you have some other expression giving the same meaning. Must is there, then is critical. Okay, is critical. It's critical that you practice your reading tests, daily tasks. When applying these guidelines to each dental practitioner is responsible. Each health professional is responsible means must, right? You are responsible to do that. Means you must do it. Do you understand?
Yes.
Okay. You are responsible for implementing these guidelines in the clinical practice and for ensuring, again, yeah, you see how many words tell you must. The whole taste and smell and fragrance and nature and culture of this paragraph is must. Require. Ensure. So don't look for must in the question stem or in the text. You have to look for all the synonymous expressions which you will gain by practice, competence. Did you get me?
Yes,
Now,
Yes,
some people may have your questions. Father, we have only 10 minutes, you said, for B part, 6 questions, and you say, now we have already taken 30 minutes. But then I did the first competent part first. I asked and require what is must is a synonym. You said immediately we found out the must. Then we got the answer. After that, we did all this circus to show you the beauty of that paragraph, so that I can make you fall in love with this beautiful thing, OET. So beautiful. Yeah. See, these are the things. Own judgment. Discernment is another synonym of judgment. Own professional discernment. Own judgment. Essential. It is important. Must is responsible. Ensuring. I'm teaching you patience, okay? Don't get angry with me. Why this father is telling all these things again and again? Guidelines. 2 questions. What is to be done and who must do it? And I tell you, there are only a couple of texts, emails, guidelines, memos. So unless if you learn 5 texts, you know exactly what is the nature of the text. Now, see the first topic sentence I said, what is to be done? Purpose of the guideline, infection-free environment or infection control. And the second thing, who has to do it? Each dental practitioner. See here, each dental practitioner. Repeated, see, everywhere you can find it. It's important to acknowledge that professional discernment is essential in the application of these guidelines to the situation of the individual dental practice environment. Means individual dental practitioner. Individual dental practices again means each dental practitioner must have their own professional, all those things. Again, you have each dental practitioner is responsible. So again, and repeatedly it's saying one's own discretion, one's own judgment, one's own responsibility. Each one is responsible. Require synonyms and synonymous used. It is important. It's essential. You must do it. it's critical, it's responsible. All these are the synonymous expressions of synonyms or synonymous expressions of the edging word require in the question stem. Now, what could be other options, synonyms of must or require? Ensure, ought to, have to,
required to, necessary to, obligated to, essential, precondition, prerequisite, imperial, imperate, got to, obligation.
Yeah, any of these words can appear. This you become very familiar as you go on practicing. But then other day from your discussions, I found you were in search of must and should, must and should. But you just neglected all my friends over there, the synonymous expressions, synonyms. Okay. Now, Nitya Binil will enjoy this, right? As she has already prepared. That's another thing. If you know the material, when I take sessions, first you do it and try to do the analysis by yourself. Then when you listen to me, it will be great. Okay, now see modal verbs. I have already said it so many times, several times. See, modal verb, present, can, past could, ability, possibility, permission. Can and could speaks about your ability, possibility, and permission. You could do that. There was a possibility that you should have done it. Okay, I can do it. Okay, may or might is the past form of may, possibility again. Should, advice, recommendation, suggestion. You should practice every day. Means you can practice, that's my recommendation. If I say you must practice every day, that is mandatory. If you don't practice, I will shout at you.
I can do make a
Okay, must is necessity, obligation, what you have seen now. These are the only possible modal verbs that you will be using.
Excuse me, Father.
Yeah, Tanuja.
Father, I have, I, thank you so much. Yesterday, that question is asked by me. Thank you very much. Clarification.
Okay.
Thank you
You are welcome.
so much, Father.
Yeah, you are welcome. Okay. She sent me the material, I believe, right? Okay. Somebody asked me the doubt. I don't remember all those things, but sometimes multiple concerns I copy. Whenever I find something that you send, I can copy into this particular slide or PPT. Now we'll do a simple paragraph analysis. Okay.
Trees are lovely. They make oxygen, which is necessary for life. We should all plant one. It could change cities by providing.
Hello.
Yes, Father.
Hello. Yeah, modal verb. Someone was asking me about modal verbs. Are you clear about it?
Yeah, yes, Father. We'll work on it. Yeah, good idea.
Do you need more explanation or should we stop here?
It's fine, Father. I will watch your previous videos again and to make sure.
Pardon?
Getting more.
Hello.
Yes.
Yeah. Any other concerns? This actually it speaks everything about videos, what you call modal verbs. Any other concerns? Yeah. Stop sharing. Yeah. Gilada, you see, you need to eat something, right?
Huh?
What's your time?
Yeah. My time?
Yeah.
It's 2:47 here. I'm in the UK.
Okay. Noon, right? Night.
Noon.
Noon, okay. Right.
Yes, sir.
Okay. And any other clarifications? Yes, you're getting it right? You're understanding the things, right?
Yes, sir.
Yeah, you're doing well. Thank you so much.
Yeah.
Thank you, sir.
And if you have any other concerns, maybe tomorrow we will keep one more session if people are available. We'll see. So that we'll do the third part C, all the texts.
Okay, sir.
Okay.
We'll
Please,
see
we
how
have an opportunity for listening also. Do you teach listening?
Yeah. There are so many sessions uploaded. We have more than around 900 plus sessions on all these 4 subtests. Like this real live sessions uploaded at the EduSkills OET YouTube channel. And that's being posted every day in the main platform. Separately,
so?
reading separately, listening separately, writing, speaking, all the 4 modules.
Okay.
Actually, we have 1 month reading, 1 month listening, 1 month writing, 1 month speaking, 4 months program.
Okay.
Yeah. And you can connect with your friends or in the main platform or in the groups. You can ask how many are ready. We can give you additional sessions. And also every day there is a task given, and every day 8:30 there is a discussion about the task. That's going to be very useful.
Okay.
In the Zoom classroom. That really helps. Okay. Yeah. Everything will be explained. And there's a discussion going on that. It's really good. That's the best thing for improving competency. Because when I teach, you just understand, but when you do it in discussion, you really get it.
Okay.
See, now these things I provided because you asked. So everything is available at our platform. So somebody asked modal verbs, I gave modal verbs. Somebody asked elimination, I gave more elimination. Somebody asked for a detailed explanation, I gave detailed explanation. So anything and everything about OET, unlimited, it's available for free at EduSkills OET platform. In the whole world, you will not find such resources free, nowhere. This is the sacrifice of many health professionals since so many years.
Thank you so much.
This is a platform by the health professionals, of the health professionals, and for the health professionals. And I am the only non-health professional here assisting the platform.
That's lovely. It's nice to hear. Thank you so much.
Thank you very much, Father. Thank you very much.
What you can do is, especially from other third world countries and all those who are financially struggling, that's our main focus. We want to help people who are financially and emotionally struggling. So if you can share the link or ask them to join, that will be great favor you are doing to the health professional platforms. That's the only favor you can do. Send it to maximum people or send the link, invite them to free platform, because many of them don't know it's a free program.
They don't know.
Yeah, many of them keep on asking me what is the cost for one module, reading only, training for only reading module. How much does it cost for all the 4 modules? I can't keep on answering, right? Let everybody know there is free resources. You have unlimited materials, unlimited video recordings of the previous sessions. They are not videos. They are live sessions like this, uploaded. All Zoom sessions. And we have enough materials, enough and more materials. Everything is free. Why should people struggle? Those who have money can definitely go to other institutions and learn. Okay, we don't object anything. But then those who are poor, financially struggling, please share with them the links. Invite them to the group. Give them the main platform link. Or give them my number. You can send them my number. Or if you feel somebody will be definitely benefited, you send me their number. I don't even require their name. I can send them the link. If they want, they will connect. Yeah. So every day at least we reach out to 10 people every day. At least 2 of them are really struggling. So that will be great blessing for us. That's the mission, focus of our mission. Charity mission. Hope you all will do that.
We will.
Yes, sir.
I will.
Yeah. At YouTube, if you want, I am ending YouTube live, okay? And if you want, you can join here in discussions. Yeah.